All right. All right. All right. All right. Oh, today is definitely one of those days, isn't it? Oh, come on. Okay. I'm trying something here. Yeah. Hi, Phil. Hi, Filski. Ooh. I'm trying something here. All right, you guys. Hey, for you guys on YouTube, thank you so much for coming back. Wait, I'm trying to get Instagram started. It says paused. You don't need to pause. Okay, that's a little high. Darn it. All right. Oh, hi, Deborah. I don't know how I can do this on YouTube. Well, okay, it's the best I can do. All right, you guys. It's been a day. It's been a day. So, believe it or not, I've been trying to set up the stream for more than 30 minutes. It turns out that Facebook implemented a new account verification. The message was, you are an influencer. You have thousands of people who watch you. Therefore, we must verify who you are. And of course, they didn't give us any notice on that, which really, really sucks. So, I finished that this morning, but now I have to wait for them to manually authorize me. And Instagram, oh, you guys. So we are not on Facebook. Hold on. I want to fix Instagram here. But we are. What? Cancel. Ah! Man, you guys, I'm having a day. Okay. And not worried about a trace of blood in your urine. If you're peeing blood clots, it's a whole nother story, but most of us have that. Anne's having a COVID flare. So, Anne, COVID is an inflammatory reaction to your bladder wall. You're going to have to ride it out, protect your bladder as much as you can, and do what you would normally do to get some comfort: chamomile herbal tea, peppermint herbal tea, et cetera, et cetera. All right. So, let me introduce myself for anybody who's new. My name is Jill Osborne. I'm the president and founder of the Interstitial Cystitis Network. I'm an IC support group leader. I'm the longest serving IC support group leader in the world right now at 29 years. It will be 30 years next September. Yes. My purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody telling you that this is all in your head. I don't want anybody telling you that you're damaged goods. I don't want anybody taking your hope away. Okay, so hold on. We're having trouble with sound on Instagram. Shoot. Okay, hold on. I normally stream these meetings. Okay, hold on a sec. Instagram, can you hear me now? Now that I'm holding it, maybe I had my, can you hear me now? Instagram. I have a lot of news to share, guys. Just like we have a lot of technical glitches this morning. So give me a moment. So Instagram, can you hear me? Testing 1, 2, 3. I think that's a big no. Hold on. Nope. Looks all right on my end. Instagram, anybody on Instagram? Can you guys hear me? Listen, if you can't hear me, come on over to YouTube because I'm streaming on YouTube right now. YouTube.com/IC and Jill. I don't know what's wrong here with your sound. I don't have sound blocked. The mic is on. Okay, well, Instagram. Hold on. Trying to get you in your container here. Testing 1, 2, 3, Instagram. I'll put you real close to my face. You're going to see a close-up of my face. All right. Oh, you guys. First of all, thank you to everybody for sending cards to my dad for his birthday. We celebrated his 100th birthday last weekend. And Deborah and Filsky wants to be a request. Honey, I can't let you into the video. I just need you to watch. Anyway, we celebrated his birthday last weekend. Okay, Deborah can't hear either. Shoot, you guys. Okay, hold on. I'm going live with Phyllis on Instagram. Maybe she can fix that. Phyllis, can you hear me?
There she is.
Can you hear me, Phyllis?
Yeah, I can hear you now. Yay.
Okay, I don't know why anybody else couldn't hear me. That's weird.
I don't know.
Okay. So now I can't see the other stream. Okay, Carla can hear me. All right. Okay. So, Phyllis, I don't know what to do now because I can't see. Oh yeah, I can see questions. Phyllis, if you want to stay there, that's fine. But just let me do my thing, okay?
Okay.
And if you have questions, feel free to do them out. But remember, we're streaming. Okay. So anyway, my dad had a fabulous birthday. It was great. 3 days later, somebody came down with 105 fever. We were praying that nobody would get sick, and none of us have gotten sick. So that's number one. Thank you to everyone who sent cards. I put them on ribbons, and they were decorations down the windows, and it was just fantastic. And hopefully, my dad will come in at some point in time, and he'll be able to talk. We'll see. Now, y'all know I have no shame and no blame, and I will talk about anything. You know that. I will talk about anything. I have the worst luck ever. You got to let me get my stuff out so I can support you, but sometimes I need support too. Worst luck ever. I go to the dentist a week ago for a teeth cleaning. I walk into the teeth cleaning. I'm feeling good. My jaw is great. My bite is perfect. I have no pain. I walk out with a fractured tooth, a fractured root. They did the cleaning too hard, and they broke a tooth. So the next time you see me next week, I'm going to be missing one of these teeth, which is coming out Wednesday morning. I cannot believe it. So send me strength this week. Hopefully I will get the dentist to pay for it, because now we have to do an implant and a crown, and that's another $5,000. And I already spent $5,000 last year repairing the other one. So send me strength, because it hurts. It's infected right now, but I'm on meds, so we're good. So anyway, I will have a fresh incision, and I won't be able to eat Thanksgiving. But I'm okay. I'm very proud that I didn't wait. I didn't wait. I knew there was a problem, literally the next day. And my dentist was out on vacation. I went to an endodontist. They confirmed it on Friday. I made my surgery appointment. We're going to do that Wednesday. So anyway, send me strength. Now in the IC world, we are preparing for a big international meeting in December. I am chairing the patient education committee for the international IC patient groups. It's very slow. We're trying to come up with some standardized patient education materials, but getting consensus from everybody is very, very difficult. So that's something I've been working on in very, very small amounts over the last 6-7 months. We have a number of new research studies that have come out, which are quite interesting. And we finally do have our IC Optimist. So the fall IC Optimist, here, Instagram, I don't know if you guys can see that. This is our patient magazine. And this is now in everybody's member pages. For everybody who's members of the IC Network, you can go right now to your member page and you can read it. For those of you who are getting it mailed to you, it is already in the mail. You should get it soon. Hi, Peggy. Hi, Sammy. And in this magazine, I want to go over just a couple of things. So a lot of the articles in our magazine you're going to find on our website. Okay, but there are in-depth articles that appear in our magazine that are not going to be put on the website for at least 6 months to a year, because obviously this is fundraising. This is how I pay the bills. So in this one, we're talking for the first time about precision medicine in the treatment of IC. Precision medicine. So what is precision medicine? It means that we're not going to blast the same treatment at everybody. That is a huge mistake. We already know it failed. We know a one treatment fits all approach does not work. We know Elmaron does not work for the great majority of patients out there. Why? Because you're diverse. You're a diverse patient population. Not everybody has a bladder wall issue. A lot of us, myself included, have a nerve and muscular issue, right? I'm trying to get Instagram right. Sorry, you guys are getting an up close look at my face. So we have very, very clear consensus now internationally that there are 3 distinct patient groups, each requiring their own treatments. So we've got bladder wall driven, we've got pelvic floor driven, and we've got central nervous system widespread pain syndrome. And as I've said consistently for the last couple of years, I had my first symptoms when I was 14 years old. I am now 62 years old. I did bladder therapies for decades. They never worked for me. Why? Because I'm pelvic floor driven and central nervous system driven. My bladder wall is fine. My bladder wall is absolutely fine. And by the way, wait. Okay, so for those of you on Twitter, and I don't know how long Twitter's going to last at this point in time, there's somebody you must follow, Stephanie Prendergast. Stephanie Prendergast is probably the top physical therapist in the world treating IC and pelvic pain. And she just put out here she is right here. You can go to my Twitter page and I forward it, but please follow her. She's at Pelvic Health. And she just put out a blog here that's so important. Pelvic floor dysfunction can feel like a UTI or prostate infection. The pelvic floor muscles surround the prostate, and when these muscles become too tight and cannot relax, they can cause symptoms in a few ways. Both the inflammation and the pelvic floor dysfunction cause irritated bladders, perineal pain, post-ejaculatory pain, etc. Inflammation can exist without infection. The prostate, this is targeted. This is for bladders and prostate. I don't need to read the rest of this. But the point here is that tight pelvic floor muscles can put pressure on the bladder, on the nerves, and on the blood vessels. And as long as we're doing that, we're creating an inflammatory process and we're creating ischemia. What is ischemia? It is oxygen deprivation. It means that the muscles are so tight, they are restricting blood flow to the bladder. They are restricting blood flow to anything in the pelvis that requires that. So if your bladder is supposed to get 24 units of blood a day and it's only getting 10 units of blood a day, is it going to be a healthy bladder? Absolutely not. That's not enough. Honey, I got to fix this on Instagram because we can hear you moving around.
Oh, sorry.
Can you step out? I mean, watch, but can you step out of sharing it? Because I don't know if I can do that.
I don't know how to do that.
Here, let me try it. I'm going to remove you from the live video,
Yeah,
but
can you mute me?
Okay, I think I got it.
Did you mute me? No.
I'm
still here.
trying. Remove from live video. So Peggy, just know that you won't be able to, I mean, you'll be able to watch for sure, okay? Technology. Okay, so anyway, getting back to my point, as long as
you
you
want me to get off and come back later,
Yeah.
or
why don't you log out and then log back in? That'd be perfect. Okay.
try it?
And for those of you on YouTube, just know we normally stream on Facebook and Instagram. Facebook failed, but I'm on Instagram right now. All right. Okay, Instagram is good. Woohoo! Ah! I'm telling you. Listen. You never know at this point in time what's going to happen whenever I do these. Hey, at least we haven't had an earthquake. Knock on wood. I've had 2 live earthquakes during live meetings, including IC conferences. Knock on wood. Knock on wood. Okay. So let's get back to what I was talking about. Precision medicine. So precision medicine means we're not going to assume you all have a bladder issue. We're not going to assume that you all need Elmeron. We're not going to assume any of that. We know a one treatment fits all approach doesn't work. So today it is supposed to be an individualized diagnostic workup. We have to understand what group you are in. Are you bladder wall? Are you pelvic floor? Are you widespread pain? And of course, in the bladder wall group, we also have to separate out Hunner's lesion patients. So Hunner's lesions are obviously a very distinct group. And then based upon your subtype, you get the treatment for your subtype. No more wasting time and wasting money doing stuff that would not work. Now, another thing that I constantly talk about is the concept of cause versus effect. You have to stop chasing your symptoms. Stop chasing your symptoms with treatments. Stop doing more and more and more and more. You have to focus on underlying causation. What is triggering this in the first place? We need to fix that. Because if we fix that, then maybe you won't have symptoms that need to be treated. Right? And so, I mean, I work with patients every day. Y'all know that. And there's definitely a group of patients who they just want more and more and more. I'm going to do this and I'm going to do this and I'm going to take this supplement and I'm going to do this treatment. And I'm going to do this. And I always stop them and I always say, okay, I respect that. Obviously, you're in a lot of pain and we want to make sure that you're not in the pain that you're in. Okay. But what's causing it? Is it tight pelvic floor muscles? Yeah. For a lot of you, it is tight pelvic floor muscles that you simply haven't treated. Bladder therapies will never fix you. They will never fix you. And listen, if you've had IC for years and literally you're continuing to flare, you're not making progress. Why? Because bladder therapies probably won't fix you. It's the pelvic floor work that will restore proper blood circulation and give those tissues the proper oxygen and nutrition that it needs to heal. Because the goal here is to heal. Now, remember too, our new AUA guidelines say that we do not believe that this is a bladder disease anymore. This is not a bladder disease. The only people who have an active disease process are maybe people with Hunner's lesions, maybe infection. Here, sorry, Instagram. You guys, I'm still kind of looking. You can see me looking around. When I'm looking here, I'm looking at YouTube. When I'm looking down here, I'm looking at Instagram. It's not a bladder disease. The only people who have signs of disease in their bladder are people with Hunner's lesions and people with infection. For the rest of us, it's neuromuscular in origin, or perhaps it's something beyond the bladder, like a fibroid tumor pushing on the bladder, or a pelvic congestion syndrome, or a bad SI joint, or a tailbone injury. It's shocking the number of you who have tailbone injuries. I find it absolutely fascinating how many of you actually have tailbone injuries. Because if that tailbone is healed out of position, bam, this is not a good thing. So precision medicine. Now here's the dilemma here. I can promise you that your urologist has not read the new guidelines. I can promise you that. Therefore, if you want to be proactive, not only for yourself, but for patients who are coming after you, then you need to print out the guidelines and bring it to them and give it to them as a gift. Because the guidelines are powerful. The guidelines provide a common sense treatment plan. One of the things the guidelines says, for example, is remember in the old days, we all thought that those little red spots on the bladder wall that we call petechial hemorrhages or glomerations, y'all remember that? We all thought that was IC. Yeah, guess what? It's not. It's not IC. It's thrown out. It is not specific to IC. It is not a sign that there's a disease process happening in the bladder. It's not. So today, again, we think of IC not as an incurable bladder disease. We think of it as a pelvic pain syndrome. So let's see here. Hold on a sec. Curtis says bladder and prostate information is important to us men. Absolutely, Curtis. Absolutely. And listen, you kick me in the side when you need to if I'm not addressing your needs too. Rose says, how do I get help? I've been having issues since October. Rose, you start with coming to our website, the IC Network, icnetwork.org, and reading about this. I need you to read our section on subtypes. You know, Carla says here, I have osteoporosis and I have pelvic floor dysfunction and diet affects my bladder, but my bladder wall is healthy. Okay. If your bladder wall is healthy, it's healthy. It's healthy. That's great news. So we're going to take that as really, really good news. And what that says is you probably don't need to spend a lot of time doing bladder treatments or money. Now we have to look beyond that, Carla. And you have pelvic floor dysfunction. You're just like me, hon. You're just like me. I have a perfectly normal bladder. I have a baby bladder. It looks good. But underneath it all, my pelvic floor is, a piece of what. I did an article like 2 magazines ago on scoliosis-driven IC. For those of you who have scoliosis, well, you probably had tight pelvic floor muscles most of your life, or at least when the scoliosis began. That could be the cause of all of this, is tight pelvic floor muscles caused by scoliosis. So, we have a lot of interesting things going on. And Rose, I'm happy. I work with patients every day. You're always welcome to call the IC Network. We have 3 phone extensions. We have our warehouse sales office. I would encourage you to think about getting our book, IC 101. It's not just a bladder disease. I think you'll find that really, really helpful. It just came out last year. And then come on over to the website and in particular start with the subtyping information, because we don't need to dive into treatment. We don't need to dive into treatment until we understand what could be causing it, what group you're in potentially. Avery says, I'm bladder wall driven. Oh, here, hold on. Rose says, my issue is urethra, not the bladder. Nobody can tell me what's wrong. So Rose, I have a really, really good article on our website. It's a blog, the 7 causes of urethral pain, the 7 causes of urethral pain. Number 1, estrogen atrophy. If you are of a certain age, if you've had hysterectomy, if you are in your 40s, 50s, 60s, you have to remember that your bladder and your urethra protect themselves with a really thick coating of mucus. We call it the mighty mucus. And the purpose of that mucus is to protect the tissue. Unfortunately, that mucus is estrogen dependent. So when you're young and have lots and lots of estrogen, you have lots and lots of mucus. And so anything that's irritating that's going through your urethra, it's not going to irritate your urethra because you got a lot of mucus in there. But once your mucosal barrier gets thinner and thinner and thinner, that urethra becomes much more vulnerable. So for me, it happened when I was 51. It felt like there was a drop of urine stuck in my urethra that would not come out, and it was irritating. It's annoying. And listen, guys, my IC self-help skills are really good. I mean, they're really good. Obviously, I wrote the IC network. I know my stuff. I threw everything I knew at this and nothing worked. Nothing worked. Why? Because it was related to my skin health. That's all. It was just related to aging. So I threw myself on the mercy of my urologist, 3 months in, and I went, please help me. What's wrong with my urethra? It's making me crazy. He took one look and he goes, Jill. And I'm like, what? I'm laying on my back. I'm in the stirrups. I'm like, what? What? He goes, didn't you use the estrogen cream I prescribed for you last year? And I went, no. And he said, why? And I said, because in my brain, I'm 25 years old and I can't possibly have an age-related issue. God's honest truth. I'm 10 years older now and I still feel 25. It's crazy. And he was like, I saw this happening a year ago. The urethra is kind of the canary in the coal mine when it comes to estrogen atrophy. And that's the first part of the urinary tract to start screaming. So I'm going to suspect, number one, that you have estrogen atrophy in your urethra. We want to look at chemical irritation. So if you've changed laundry detergents, if you are using a different type of soap, if you're wearing a different kind of mini pad, that can all release chemicals which can irritate you. We're going to look at tight pelvic floor muscles. Tight pelvic floor muscles will squeeze the urethra. So go on over to the IC Network website, icnetwork.org, and just search on the website for urethra, and you'll find that blog, and it's great. It goes through everything. Kate Howe says, when will Peora be back in stock? The Peora should be back in stock very, very soon. I'm going to say within a week. We've got 3 different shipments coming in. I've got Bladder Rest, I've got Peora coming in, and I have Bladder Builder coming in again at the end of December. So along with Bladder Smart, our low acid vitamin. So they're all in the process. They've all been, I think Peora's already been made. We're just waiting for it to get on a truck. They do a lot of testing. They test all the ingredients when the ingredients arrive at the plant. And then for purity, and then after it's made, they do another round of testing to make sure the capsule itself is very safe. And so they're just finishing that up, and then they will send it back to us and we will have it. I don't have another brand for you right now. Just hold tight. We will have it. I promise you. I already know because I've already paid for it. Christina says, I've suffered most of my life. I finally recently applied for SSI disability after my divorce. I can only hold 4 ounces without pain. I see Dr. Moldwin. Any tips for SSI? I barely sleep. So Christina, you have a tiny, tiny bladder. And if you can only hold 4 ounces, wow, your bladder capacity is remarkably small. Why does that happen? Well, that can happen because of scarring. That can happen if treatments have kind of damaged your bladder. That can happen if you were drinking, if you went through chemotherapy where the chemicals of the chemo was really damaging your bladder wall. It can happen if you were drinking a massive amount of diet soda. It can happen if you've had a lot of UTIs where the bladder, the bladder is a really remarkable organ. I mean, because it's the only organ, well, aside from the stomach, that gets bigger and bigger and bigger as it gets full, and then it shrinks back down and gets smaller and smaller and smaller. It's like a balloon. And the mechanics of that, they still really don't quite understand how the bladder can do that so successfully. These are part of what we call basic bladder studies. So a good healthy bladder can stretch and contract without any pain, without any discomfort. A bladder that is scarred cannot stretch. A bladder that is very, very inflamed will not stretch. Christina said, he thinks it may be nerves because my bladder looks normal. We did a cysto while I was awake. I have no answers. I've never had a UTI. That's odd. So Christina's saying here, so you guys, Christina is on Instagram. Dr. Molden thinks it's nerves because my bladder wall looks normal. We did a cysto while I was awake and I have no answers. Christina, there's something called awake bladder capacity versus anesthetized bladder capacity. So when you're asleep and they're doing a hydrodistension, they will be able to kind of bypass those sensory messages that will give you discomfort, right? And so when you're asleep and they stretch your bladder, that's a real-time, real assessment of how much your bladder will hold. But when you're awake, you've got a lot of sensory information processing. And so the nerves start speaking to you when you have very, very, very little. Oh, how can I say this? How can I say this? I want to say this the right way. So we have two nerve groups in the bladder. We've got the alpha afferent nerves, which control frequency, urgency. We've got the C fiber, which control pain. The alpha afferent nerves are very, very easy to turn on because they're the nerves that tell you when you need to pee. So when your bladder fills to a certain point, normally the alpha afferent nerve kicks in and sends a message to your brain, hey, I need to pee. And your brain says, okay, go pee. Nerve sensitization, nerve dysfunction can be experienced as feeling pain when there's nothing that's there that's actually hurting you, or feeling full even when you're empty. That your bladder gives you the symptoms of frequency, urgency, like your bladder's, you feel burstingly full, like you desperately need to pee. But when you go to pee, there's nothing there. And there's legitimately nothing there. It's that false sense of fullness. And so when you're awake, there's a lot of different messages your brain has to process. And so there's anesthetized bladder capacity versus awake bladder capacity. And I think that Dr. Molden's probably right because your bladder wall's healthy. And so that means that the nerves in your bladder wall are very, very sensitive. He says doing a hydro would do more harm than good, so I haven't had one. I think that that's reasonable. I think that I don't have a problem with. Listen, I don't like guessing. I like facts. If you've had symptoms for 10 years and you've never let somebody look in your bladder, I think that that's a mistake, especially if you're bleeding, because we need eyeballs on the bladder wall to see if there's any weirdness going on the bladder. And so doing an in-office cystoscopy is very routine. I call it a looky-loo. They numb your urethra, stick a cystoscope in, take a look around, pull it out, you're done. 5 minutes in and out. A hydrodistension is a more aggressive procedure where they fill your bladder with fluid, stretch a little bit, drain it out, fill it up again, hold it, drain it out, and take a look at your bladder. And that procedure by itself is damaging. It is damaging. This is why we do low pressure, short duration hydrodistensions. So, Christina, here's the deal. Robert Molden is one of the best doctors in the world. If he looked in your bladder with a plain cysto and you have a normal bladder, there's probably no reason for you to have a hydro. Hydros are only done when the diagnosis is in doubt. If he saw something abnormal on your bladder wall and he wanted a closer look at it, he would say, yes, do a hydrodistension. Yes. And that's fine. But this is a trend now. We no longer want to do aggressive testing that has the ability to damage. He's looked in your bladder wall. You've got a good bladder wall. Now we got to figure out why your nerves are so annoyed, because your nerves are certainly annoyed here. So is it pelvic floor? Do you have tight pelvic floor muscles that are traumatizing nerves? I would be looking at that. I would be looking at fibroids pushing on your bladder. I would be looking at pelvic congestion syndrome. I would be looking at anything else that can irritate those nerves. I'm going to seize. Excuse me. Do you have any lower back issues by your sacrum, L4, L5, that could also help us understand what's going on with your nerves down there, right? And in the meantime, you got to be perfect. You got to be perfect with your diet here. No caffeine. We don't want to do anything that's neurostimulatory. You should be doing chamomile herbal tea, peppermint herbal tea, which are nice, smooth muscle relaxants. And doing things that calm nerves down would be perfectly reasonable. So it would be interesting to see how you did with aloe. Just aloe has been around for many, many years. Most of you know the most popular company, Desert Harvest Aloe. Aloe has a soothing effect on the bladder. So it would be fascinating to see if aloe could help kind of calm and soothe your bladder wall and calm some of those symptoms. It's possible. Now, the aloe that I really, really like is called Aloe Path. And the reason why I like it is because it's aloe combined with PEA, palmitoyl ethanolamide, which is proven to calm nerves down. So it would be very interesting maybe to try Aloe Path. Now, some people are intolerant to aloe. And there's no way I can tell you if you're going to be or not. So whatever aloe you try, take one capsule, wait a day, take it with food, see how you do. Some people do get a little bit of stomach upset when they take aloe. But Aloe Path would be fascinating for you because you've got the soothing effect of the aloe on the bladder wall combined with the Peora, which we now know really calms nerves down. And we have the research that proves that. And a major ICPEA research study. So let me see if I have the bottle. Hold on a sec. Do I even? Yeah, I do. Woo! And I'm super casual today, guys. Super casual. This is what happens when you have a toothache. Okay. So Aloe Path really would be a very interesting experiment. And it would also be very interesting to see if you responded to a rescue installation, which has a bladder coating in it, heparin combined with lidocaine to numb the nerves. That would be interesting to see if that would help calm those down. But given that you have a healthy bladder wall, it doesn't make sense to do bladder coatings, right? That doesn't make so much sense. Avery says, I'm bladder wall driven and I've not been helped by any of the bladder wall therapies. I don't know what to do. I've even had all the pelvic floor therapies to no benefit, no Hunner's lesions. So, Avery, the devil is in the details here. Tell us, if you're still here, tell us about your symptoms. And I mean, yes, you have frequency urgency, but I want to know the weird symptoms. Do you have pain on the left side? Do you have pain on the right side? Do you have pain on the outside? Do you have pain internally? Do you ever have pain that shoots down your leg? Tell us a little bit more about your symptoms, hon. Mary says, I've been recently diagnosed with SIBO. Apparently, bad bacteria-like organisms are in the wrong place. I was told this can affect the pelvic organs in the bladder. Have you ever heard of this? Yes, certainly. SIBO, is it small intestinal bacterial overgrowth? I think that's what it stands for. We certainly know in basic biome studies in the IC patient population that our bowel biome is a little off. And that we have high levels of things we're not supposed to have high levels of, and we have low levels of things we're supposed to. They're reversed. They're reversed. So we know that the bacterial biome in the IC patient population in the bowel has the potential of being off. Now, why? Well, because we've all taken antibiotics. And a lot of you watching right now, when you flare, you've got that extra bottle of antibiotic in your bedside table, and you take it just to be on the safe side. You do that. How do I know that? Because I used to do that. But that's the type of thing that's going to really damage the biome in the bowel. We don't treat flares with antibiotics. We only use antibiotics if there's proven infection. I have a big prescription of amoxicillin that I'm supposed to be taking for this tooth. I'm not taking it yet. Even though it's cracked and infected now. I'm waiting. I'm waiting just a little bit because I don't want to damage my whole biome. The pain isn't that bad yet. Which just, okay, that was very hypocritical of me saying that, because I believe in catching things early. So I'm going to have to think about that. I mean, I only got them yesterday. I didn't take them last night. So I was thinking I would take them maybe tonight after I go do my walk. Life is very complex. All right, hold on a sec, guys. Okay, hold on. There's a lot of questions on YouTube, and I got to scroll through it. Okay, so again, Peora I should have in a week. Hi, Kayleen. Hey, girl. Loved your latest TikTok. What I love seeing strength. I love seeing people embrace their strength. And the challenge with having a chronic injury or chronic disease is that we feel very, very beaten down at times. It's very hard to advocate for yourself when you feel like crap. And yet we have to advocate for ourselves. We are the boss. You pay the doctor. They don't pay you. You're the boss. You're the one who should be making the big decisions here. They're supposed to educate you and help you make decisions. And part of that comes with reclaiming our confidence and reclaiming our strength. And that's what I loved about one of your most recent TikToks, Kayleen. Angie said, if you have a healthy bladder and it's your pelvic floor, why does diet affect you? Because of ischemia. If your pelvic floor is tight, it's restricting blood flow to your bladder. And because it's restricting blood flow to your bladder wall is not getting the oxygenation and nutrition it needs to be healthy. So you are absolutely going to be diet sensitive with tight pelvic floor muscles, especially chronically tight. That's how, but again, bladder therapies are not going to work because fundamentally it's not a bladder wall issue. It's a blood flow issue. It's an ischemic issue from tight pelvic floor muscles. Christina said, pelvic floor did not have any triggers, no back issues, so we shall see. I think I would like to try the InterStim trial. Allomeds didn't help, but pumpkin did. I will try. Yeah, I think the allopath would be interesting. Let me describe a typical flare. Okay, so a typical flare, a typical bladder wall flare is you go to bed at 11. Of course, you pee before you go to bed. You wake up at midnight. Your bladder feels very, very full. You go to the bathroom. You pee out a quarter cup of urine. You go back to bed. You wake up 30 minutes later. Your bladder feels really, really full. You go to the bathroom. You pee out maybe a tablespoon. You go back to bed 15 minutes later. Your bladder feels very, very full. You go to the bathroom. You sit there and nothing comes out. And you start straining and straining and straining and nothing comes out, maybe a drop or two. That's the false sense of fullness. And you got to stop yourself from straining to push urine out. That's the penultimate way that your bladder tells you that it is supremely angry. So the times that happened to me, though they were almost all bladder wall driven, diet driven. I have an article called Anatomy of an Utterly Ridiculous Icy Flare when that happened, where I started the morning, I don't know, with a smoothie, and then I did something else, and then I had enchiladas for dinner, and oh, holy hell, was that a terrible flare with a lot of false sense of fullness. That was like my first year with IC where I didn't know any better. The other thing that I really want to look at too is anytime you have that false sense of fullness, that's always telling me, again, your bladder wall is really, really irritated, that there's something in your daily life which is irritating the hell out of your bladder, Christina. Are you taking a multivitamin? Are you drinking alkaline water? Are you drinking Brita water? The Brita filter is too good. It's an outstanding water filter, but it takes out all the pH balancing minerals. And so what happens is that the water that comes out of a Brita filter is often very acidic. So if you're drinking acid water all day, if you're drinking alkaline water all day, if you're taking a multivitamin all day. And so in many cases, it's something very, very innocuous that you think is really good for you that is not good for you at all. Rose said, I'm only 32 and recently had a bladder infection. Then all this urethra stuff started. So Rose, number one, again, estrogen levels matter. So if you're on birth control, that could drop your estrogen levels down and make your urethra more irritated. But here's something that's very interesting. Did you know that women have a prostate? We do. You know, men have prostates, obviously, at the top of their urethra. Well, women have prostates too. They're called periurethral glands. So our urethra is about the size of our little finger. And our female prostate is about halfway up, and it's like a sea sponge that wraps around the urethra. And like the male prostate, it can become easily infected. And like the male prostate, the little tiny drainage ducts get blocked, and you end up with the equivalent of a pimple halfway up your urethra. So it is possible that you could have picked up a periurethral infection in that gland. But there's a really easy way to figure out if that's going on. And that is that if you have some gloves, a little bit of KY, next time you're in the bathroom, you can put your finger up inside your vagina, just not far, like an inch, not far at all. Because remember, your urethra is this big, so your periurethral gland is right here. So you can just wash your hands really well, wear a glove, use a little bit of KY, and you can stick your finger up there just a little tiny bit and rub on the front side of your urethra. I mean, of your vagina, because your urethra is in front of your vagina. So just palpate. And if you feel any tender, painful bumps, it's like a deep pimple that can be at the most the size of a green pea. So if you feel any painful bumps, then that's an infected gland. So that's something that we would look at too. Deborah says, I have tightness of the bladder wall and you have an aneurysm of your aorta. Deborah, I'm so sorry, hon. I'm so sorry. Now, aortic aneurysms are a well-reported side effect of using Cipro, which happened to be an antibiotic that a lot of us used to be given for our quote-unquote bladder issues. And so you would not be the first ICer who has developed an aortic aneurysm. In fact, one of our most famous ICers of all has been dealing with an aortic aneurysm from that for years. And so she has her blood vessels checked every 3 to 6 months. And so hopefully you're getting the care that you need for that. Crossing your fingers, sending you lots and lots and lots of love, hon. Lots and lots and lots of love. Tightness of the bladder wall. Your bladder wall is composed of smooth muscle. Your skeletal, your pelvic floor is composed of skeletal muscle. So they're completely different types of muscles. If your smooth muscle is tight and spasming, then that's where you would try something like Myrbetrix or ditropan detrol. Myrbetrix doesn't have the same the risk of side effects that the ditropan has. If you're ever having bladder spasms, that's what you would use. You would use Myrbetrix, you would use ditropan or detrol. Phyllis says, are we going to get a separate site for Hunners? You already have one. I built it 2 years ago, hunnerslesions.org or hunnersulcers.org. Kayleen says, I can hold 8 ounces without pain, but I was 10 ounces for an ultrasound before and I couldn't stop screaming and crying. So that's a perfect example of awake bladder capacity and those nerves triggering your brain and giving you that pain. Mary says SIBO can affect pelvic nerves. I'm not really up on SIBO. I haven't done a lot of reading on it, to be quite honest. Thank you, Renee. Hi, Gay. Hi, Les. Avery says, I have constant burning pain throughout the bladder. When I have lidocaine in my bladder, I feel better. Okay, so if you feel better after having a rescue installation, so lidocaine is a numbing agent. Lidocaine can numb the bladder wall, just like Marcaine can. So you're doing what we call the anesthetic challenge, where if we put an anesthetic in your bladder and your symptoms go away, then that kind of tells us your bladder wall is part of the problem. So we now have to try to figure out why your bladder wall is compromised. Is it compromised because you've lost estrogen? Is it compromised because it is being irritated chemically in some way? Both are possible. Is it compromised because you have infection? Absolutely. Infection damages tissue. Cipriti said, I've had so many bladder infections since COVID 3 times, hair loss, thyroid inconsistency, now developing heart issues. I'm not vaxxed. This is just since getting COVID. Cipriti, honey, come on. I'm so sorry. It is infuriating to me, the people who have minimized COVID, because COVID is not a respiratory virus. COVID attacks blood vessels and does tremendous damage to blood vessels throughout the body, in addition to the cytokine storm. So you're dealing with COVID cystitis. COVID cystitis is real. We knew in the first 2 months of COVID, researchers in Europe were finding patients who were struggling with this massive increase in their bladder symptoms after getting COVID. Why? Well, it's a cytokine storm. It's this massive inflammatory process that's affecting the entire body. Well, we're finding those cytokine storm markers in urine and in your bladder. But for people who are the most ill, for those people who've been hospitalized with very, very severe COVID, they're actually finding live virus in the bladder, right? And so it becomes a viral infection of the bladder. That's much rarer than just the cytokine storm, but they're both possible. I just want you to know, Cipriti, that the researchers they're working so hard to understand the short and long-term effects of COVID. They are dedicated to finding answers for you. They are. So please be patient, which is very hard. Protect your bladder as much as you can. Again, you got to really improve your diet. Organic whenever you can. Obviously, nothing that will irritate your bladder. No coffee, no tea, no soda, no juice, no multivitamins, unless it's a low-acid multivitamin. We just got to do everything we can to protect and calm that tissue down, okay? What our research shows, and in fact, I just emailed 2 weeks ago, I just emailed all the top IC doctors in the nation again to ask if they had any new resources for COVID cystitis, and the answer was no. What they did say is that it does have an end, that it does appear to be short. Well, for you, it feels long-term, but that COVID cystitis symptoms usually take 6 months or so to really calm down and go away. So we're going to cross our fingers that once you really protect your bladder, everything will calm down and things will get better. Mary says, I just ordered Bladder Builder this morning. It is not shipping until the end of December. That's not true, honey. We have it right now. We can ship it to you tomorrow. I don't know where you ordered it from. There's a scammer out there who's buying product and selling it for a very high cost. Hold on. Let me log into my store here. Hold on one second. So the IC network, we do have a mail order center with stuff for IC in it. We had, the last time I looked, we had plenty of bladder builder, hundreds of bottles. Hold on. Oh, hun, we have hundreds of bottles. So we're at Mary, wherever you ordered it, cancel it. Come on over to the IC network, go into our store. We can send it to you tomorrow. That is crazy. I don't know who's doing that. You know, we are the exclusives for bladder builder and bladder rest in the country. Kayleen said, I was in the ER last night for really bad incontinence and my back pain spread from neck to toe. They said it was an emergency, so they took me to a room right away. The doctor did a physical exam, gave me Percocet, and you got sent home with oxycodone. But why the hell were you incontinent? Did they check your back, hun? I mean, anytime we look at a sudden and severe onset of incontinence, bladder or bowel, we always have to look for ruptured discs. And you do have that back history, hun. Are you still struggling now? Are you still having incontinence now? Cora says, do you happen to know if levofloxacin given for UTI has the ability to damage nerves? I lost all feeling in that area and can no longer feel as much as I do. Let's look it up. Let's see what Medline says. Well, okay, so it is in the Cipro category. It can cause ruptured discs, et cetera, et cetera. Levofloxacin may cause changes in sensation and nerve damage that may not go away even after you stop taking it. The damage may occur as soon as you begin taking it. Tell your doctor if you've ever had any peripheral neuropathy. If you experience any of the following symptoms, stop taking levofloxacin. Call your doctor immediately. That's numbness, tingling, pain, burning, weakness in the arms or legs, or a change in your ability to feel light touch, vibrations, pain, heat, or cold. You know, I took one Bactrim DS, and my ears started roaring. It was like having a semi vibrating in my head. That's never gone away, except now instead of this big heavy rumbling, this now it's this really high pitched electrical thing. That's medications are challenging. And this is why when you look at our AUA guidelines, they want you to do all the self-help and they want you to try supplements before you try major medications like that, because the supplements don't carry the same risk of adverse event. And that's not me saying that. That's the American Urology Association say that. Okay, let me come back here to Instagram real quick. Christina said the installation didn't hurt. Hey, sup, Jenna. Hey, Erica. Hey, Lady Liberty. You guys, I'm simulcasting live on YouTube and Instagram right now. Facebook is not happening right now. They instituted a new account verification, and they have to approve me to let me do videos again. Hello, Rebecca. Hello, Jenna from England. Hi, Eva. B-Rest says, I've had 2 sessions after my internal pelvic release. It felt good. After a second, then you felt burning in your parts. Okay, so that comes as no surprise, hon. You know, because so when you're relaxing those muscles, that is immediately restoring blood supply, right? And so you might feel warmth as the blood perfuses that area and feel better. And, you know, but you're also getting in there and you're touching muscles over nerves and things like that. So you definitely want to tell the physical therapist about that symptom and see if they can figure out why that's happening. You know, physical therapy should not hurt over time. You should not be in agony when you do physical therapy. You should not be in agony as you're walking out of physical therapy. If you are, they're being too aggressive. They have to go slow. Slower. Christina says, so alkaline water isn't good. What water is good? Spring water, hun, not alkaline water. Hey, look at this. Nicole Kosian, one of the best physical therapists in the world treating IC. She's the author of the book, The Interstitial Cystitis Solution, joined on Instagram. Hey, Nicole, if you're still there. I'm simulcasting, so I'm switching between YouTube and Instagram right now. If you want to see her book, let's see, I have it right here. Where is it? Okay, so this is Nicole Kosian's book. This came out, like 4 or 5 years ago? So this is before we had our subtyping and our distinct patient groups. And as you can see, I study every book that comes out. I really want to, this is how I educate myself, along with going to conferences and things like that. So Nicole was really the first to create a book that embraced the connection between the bladder and the pelvic floor, and explaining some of those connections here. And she's got a nice discussion of treatments and pelvic floor physical therapy and all sorts of good stuff here. The pelvic floor connection, it's not just your bladder. The fact is that the bladder doesn't exist in isolation. It's intrinsically connected with all the muscles, ligaments, and tissue that surround the organ, collectively known as the pelvic floor. And every symptom of interstitial cystitis, suprapubic pain, urinary urgency, frequency, nocturia, low back pain, incontinence, and the rest can be caused by dysfunction of the pelvic floor. So this is absolutely a viable book for you to get to learn more about this and read more about this. The more, the better. You gotta have. Your job as a patient is to read whatever you can, and then take out the stuff that applies to you. So I'm not saying that my book is the only book you should read. Absolutely not. And one of my favorite books is Breaking Through Chronic Pelvic Pain by Jerome Weiss. For anybody who has a history of injury, pelvic injury, if you were an athlete, anything at all like that, this book is the bomb also. So we've got a lot of great resources now for ICers and pelvic pain patients that we did not have years ago. It's a great resource for you. So again, it's not the alkaline water, it's not the acid water, it's the spring water. We need water that has a good, healthy balance of minerals. So Jenna says, can tight pelvic floor muscles cause the bladder to become inflamed? I've just been diagnosed. Yes, it can, absolutely. Hello, Belinda. So Jenna said the camera check showed inflammation, but no infection. I just have had one session with pelvic floor. And guys, also understand that if you've had tight pelvic floor muscles for a long time, one appointment is not going to make it better. This is about muscle memory. This is about reteaching your muscles how to be relaxed, because they have been stuck in tension for a long period of time. And it's not just you going to the physical therapist. It's about you recognizing tension when you're at home. And if necessary, using the exercises that they give you, the wands that they give you that will help you. And speaking of that, I have brought in a new wand. So you guys know that for me, when my pelvic floor muscles get tight, I know exactly what to do. You can literally monitor your pelvic floor tension just by how you're urinating. When you go and urinate, if you can relax and you can pee like a horse, your pelvic floor is good. But if you're stopping and starting and you've got thin flow, it feels like you're trying to pee through a needle, pulling, pushing, anything at all like that, that's kind of a clue that your muscles might be a little bit screwed up. So, let's see here. Hold on. So the wand that I first started to use is this Easy Magic wand, this glass wand that I love. I mean, this is exactly what I use. You can get it from Desert Harvest. Okay, but anatomy is different. There are a lot of different factors that can control, how to access those muscles. And you might have a bad arm, a bad leg. You need something that's just maybe a little bit longer. So we have now brought in these. And this is by Soul Source Therapeutic Devices. And so if we get out our model here, so here's our pelvic model, right? And when we look on the inside, you get to see your pelvic floor muscles. So your pelvic floor muscles basically sit on top of the bone. This is why it's very hard to do physical therapy externally. When you go internally, that's when you can really reach those muscles. And so when that physical therapist is working with you, they usually have a finger in your vagina or in your rectum. And what they're going to be doing is they're going to be working on these muscles directly, right? And they can go pretty deep. I mean, it's very interesting that a physical therapist they're actually basically touching your bones, and it doesn't hurt at all. I mean, it's fascinating. I mean, if your muscles are messed up, it might, but I haven't found this part to ever be particularly painful. And so that's why your physical therapist is going to be doing some internal work. But when you're at home, how are you going to do that? Because your finger is not going to reach as much unless you're a contortionist. And this is where using a glass wand, right, vaginally or rectally, you can see here, you see how easy it is to get to these deeper muscles. See that? And a good healthy muscle feels like a raw chicken breast. It feels good. A tight muscle feels like beef jerky, and it's painful. It's tender, sensitive beef jerky. And for me, it's always on one side and not the other side. And it takes me about 3 to 4 minutes of working with these muscles to get it back into that normal muscle tone and out of the beef jerky tight tension phase. Whoops. There you go. So this one may work a little bit better for some people. You can see it's a little bit longer. And so if this is not already in the ICNet shop, it will be in soon. And so I'm very happy about that. It's always good to have more resources. Okay, here, hold on a sec on Instagram here. Hi, Bathsheba. Belinda says physical therapy has always helped with their pelvic floor. Good to know. It always helps me, no doubt about it. The problem is getting in. I'm part of Kaiser Permanente, and consistency. You normally when they're working on tight pelvic floor muscles, we want to get in every week for like 6 to 8 weeks. You're lucky at Kaiser to get in once a month, which sucks. Red Sox says, any new meds, honey? That's exactly the wrong question, because we can't talk about medicine until we understand what subgroup you're in, right? We practice precision medicine today. Now we're not giving everybody Elmeron and giving everybody the diet and whatever. Now we are trying to understand what your underlying cause is so that we can treat the underlying cause correctly. We're no longer putting somebody on Elmeron for 20 years. And unfortunately, for some of them ending up with eye damage. Filski says, how do I feel about phenazopyridine, the stuff that turns your urine orange? That's a short-term anesthetic for the bladder wall. It covers symptoms. It might be slightly helpful in managing symptoms, but it's really not going to touch bigger pain. I will tell you that for me, when my bladder wall was screaming, it never helped me. But if it works for you, reasonable, but you're not meant to take pyridium for long periods of time. azo for long periods of time. It's really meant to be used for like 3 to 4 days at a time. There are significant risks using this medication every day over time. And I'm trying to remember if it's liver or kidney, but not meant to be used daily. Belinda says, I've been to several physical therapists over the years. You need to have good chemistry with the therapist for successful outcomes. If you're not comfortable, find another therapist. Exactly. Jenna said it all started with an incredible stressful period. Within a month, I had awful, painful bladder symptoms. Well, Jenna, I think we need to take a step back and ask, why did you have such a bad period? Do you have endometriosis? Because if you've got endometriosis, which is messing with your periods, well, endometriosis can also attach to your bladder and mess with your bladder. Belinda says we gotta love up on our pelvic floor, show those muscles some love. Exactly. It's really interesting that there are some women out there who have never had pain-free sex. Never. They have never had pain-free sex. Their muscles have been locked down tight from childhood. And they're stunned to discover that sex isn't supposed to be painful. To them, that's normal. And that's not normal. That's vaginismus. That means that there was some sort of trauma or something that happened in childhood that locked those muscles down tight. And a good example was a gentleman that I worked with last year or the year before who, and I don't want to gross you out, but I mean, we got to be real here. If you struggled with bedwetting and your mom beat you when you wet the bed, believe me, you're going to subconsciously tighten your pelvic floor so that you don't wet the bed. And so if you had in fact, that was one of the very first questions that Dr. Marshall Stoller asked me when I was referred to him at UCSF back in 1993. He said, were you a bedwetter and did anybody hurt you? And I went, no. So abuse. And I have a much more grisly story of something that happened like that I will not share because it will give you nightmares. But, suffice it to say that there are some parents out there who simply don't know. They're just not educated. They're not educated about bladders, and they're not educated about bowels, and that child is beaten terribly and abused. And so anyway, I guess the point that I'm trying to say is if sex is painful, and it's always been painful, please get your pelvic floor checked because the odds are you have vaginismus. It could also come from if you were a young dancer. Worked with a woman in Texas who was a dancer and a cheerleader for many, many years, and her specialty was flying splits. So, where they jump up and they split and they land on their crotch and they land on their pelvic floor. You can darn well bet many of those cheerleaders are going to have pelvic floor issues, or even ballet, because in ballet you're taught to tuck under. And so your pelvis, your pelvis and your, I don't know, can I demonstrate? I did ballet for a few years myself, but see, I'm not wearing the right clothes. But healthy body position, you can see your back is slightly, your butt's kind of out a little bit. But when you do ballet, you're taught to tuck under. You tuck under, and that's not a normal position for the pelvic floor. All right. Okay, let me get back here to YouTube. Beth said, I had a hysterectomy in March and my pelvic pain is much worse afterwards. I had pudendal neuralgia and I'm not sure how to handle all this burning in my vulva. So, Beth, girl, hysterectomy is the hardest surgery that a woman can have. I had it too 6 years ago. And I will tell you, my pelvic floor was toast the year afterwards, absolute toast. And so getting into pelvic floor physical therapy to work on the health of those muscles is important. The fact that you have pudendal neuralgia, means that either your muscles are tight and they're squeezing a nerve, or it means that maybe a nerve was actually damaged in some way with the surgery. But that burning on your vulva can also be estrogen atrophy, because now if you had a total hysterectomy, it takes a couple of months for your estrogen levels to really drop to the point that your skin starts to change on your vulva, in your vagina. And basically, when you have hysterectomy, honestly, it's like you age 10 years that first year, just with that loss of estrogen. DJ says, I've been trying to figure out if I'm flaring or dealing with a UTI. I have a fever, back pain, urgency burning, but my urine isn't cloudy. Honey, IC does not cause fever. If you have fever, then that is a sign that your body is fighting infection. I have an infected tooth right now. I feel your pain. And actually, in our latest magazine, the IC Optimist, we have UTI or flare. That is the question. This is an article I wrote to help you distinguish between a UTI as compared to a bladder wall flare. And let's just go to that. Hold on a sec. All right, what page is it on? Page 14. Here we go. UTI or flare, that is the question. So basically, let's see. Here. Let's just kind of go through the protocol here first. When bladder symptoms first strike, every IC patient usually assumes they have a UTI. A quick visit to your doctor along with a urine dipstick and culture usually proves that no infection is present. For the great majority of us, no infection is present. Yet, the often confused patient running to the restroom every 15 minutes, it's hard to understand how this could not be infection. Many ICUs have assumed they were struggling with recurring infections for years, only to discover after the fact that their symptoms were being driven by tight pelvic floor muscles. Yet, it is an undeniable fact that UTIs do occur. From swimming to sex, there is always a chance that bacteria can be introduced to the bladder. In fact, an estimated 50 to 60% of women will experience a UTI at least once in her life. Throw in an increased risk of infection when catheterized, having a bladder installation or cystoscopy with hydrodistension, we could argue that IC patients may be more at risk of UTI. But distinctive symptoms of a UTI that differ from an IC flare include mild fever, cloudy urine with an odor, visible blood in the urine, nausea, urine leakage, and pain or burning while urinating. The only definitive way to determine whether you have a UTI is with urine testing. You can start with a at-home dipstick. Anyway, I go through that. Then you can do a urine culture. And then if the urine culture is not particularly helpful, you can do a next generation DNA urine test to try to identify the infection. But again, if you have fever, IC, a bladder wall flare does not cause fever. Infection causes fever. So yeah, I think you have infection. Sandy says, should I not take, here, hold on. Should I not take Bladder Builder if my issues are not my bladder? Well, Bladder Builder does a lot of different things. So yes, it has chondroitin for your bladder wall that can certainly provide a little bit of protection. It has quercetin for the antihistaminic effect. It's got some beneficial probiotics and amino acids. But Bladder Builder also has PEA in it to calm nerves down. So if you have a healthy bladder wall, then there's no reason for you to take a chondroitin supplement, unless, of course, you're getting older and, you're losing that estrogen and your bladder wall is now compromised because of the estrogen loss. So if your symptoms are really neurological in origin, if you've got the widespread pain or you've got pain caused by very tight pelvic floor muscles, then I would instead just be doing this. It's half the price, Peora, and it would be more effective. You're not wasting time doing something that is rather pointless. You have a healthy bladder wall, right? Like I don't take a chondroitin supplement, and I don't take a chondroitin supplement because I have a perfectly healthy bladder wall right now. And yeah, I'm older, but I'm using topical estrogen, which is giving my bladder wall some of the estrogen it needs to be healthy. And I'm not having any weird, unusual bladder symptoms right now. So I'm really not worried about my bladder wall. My pelvic floor is my fundamental problem and my central nervous system. My nerves, I have very sensitive skin, wicked sense of smell. Those are all signs of chronic overlapping pain condition, central sensitization, right? And so I'm always very invested in keeping my nervous system calm. Because when it gets irritated, I get annoyed. And so this is what I take. I take Peora, and I love it. And I love it because I don't have the pins and needles in my skin anymore like I used to. DJ says, also I have my regular Urogyne. She called Dr. Day, who says hi again, to try bladder neck Botox. Can you tell me about it? Dr. Day wants to do another urodynamics test. Well, Botox calms nerves down, and it's a viable option. We have a whole section of it on the IC Network website. The concern with Botox is that it silences every nerve it touches. And so if it happens to touch the nerve that controls your ability to pee, you might not be able to pee afterwards. You may have to self-catheterize for a period of time until the Botox wears off. That is the number one risk of Botox therapy. Kayleen said, they didn't say this, but I think I know what it is. My tailbone is pushing forward, making my urethra aim forward. So when I sneeze or cough, it pushes urine out. I know the nerves are bad in my vulva. Yeah, the tailbone, you guys, if we look at the model here, let's look at the model here. So this is the backside of your pelvis. So obviously we have your spinal, your vertebrae. Then we have your sacrum, which is basically a fused vertebrae. And you're going to notice that there are 8 total holes in the sacrum. Nerves actually go from the spine through these holes and into the pelvis. They emerge here. And then they actually go through muscle to reach different parts of your body, like your legs and things like that. If you ever have sciatica, the pain that shoots down your leg, okay, that's because the nerve is being squeezed up here, usually by the piriformis muscle. So again, let's look at the tailbone for a moment. So the tailbone is not passive, it's active. And look at everything that attaches to the tailbone, left side and right side. The tailbone actually kind of helps you balance. It kind of moves with you. It's fascinating. And so the tailbone is supposed to be gently curved under. But what happens is if you've broken your tailbone, if there's a chance it might heal out of position. So if that tailbone is now sticking out instead of curving under, that could be a huge problem. Or if the tailbone is kinked to the left or to the right, that also, if it's kinked to one side, then we've got a muscle group here that's stretched and a muscle group here that is contracted, and that could be a big problem. So tailbone issues are common. DJ said, my first was excruciating and showed bladder neck obstruction the first time. It's been 6 years, so she wants a new one before she does it. Is there any way to make it a bit better? You're talking about a urodynamics? Listen, Dr. Day is just a phenomenal doctor, very, very well respected. She's one of the editors of the book Facing Pelvic Pain. She worked with Harvard. You can bet that if there's anything that she can do to try to make that procedure more comfortable for you, I'm sure she will do that. So you guys, a urodynamics basically tests the function of your nerves when you're awake. So basically what happens is you go to the doctor and they put an instrument in your bladder through your urethra, and then they start filling your bladder with fluid. And they're going to ask, okay, tell us when you first feel the need to urinate. Tell us when you first feel pain. And all they're doing is they're just testing that waking bladder capacity. They're testing those nerves down there to see if they're healthy. So generally the questions are, tell us when you first feel the need to urinate. Tell us when you first feel discomfort. And I know when I had it, they pushed it a little bit past that point and kept filling my bladder until I like yelled at them and said, "Stop it. That hurts." And they stopped it. So the test doesn't scare me at all. I think the big issue is just your urethra is going to be quite tender for a day or two because they put an instrument in that. But we know that that goes away. You know, whenever you have a catheter put in your bladder, anything at all, any instruments put in your bladder, you have to understand that that urethra gets stretched, and the urethra doesn't like things in it. And so generally after the test, the first time or two that you pee is hard. It's very, very painful. And so I had, when I was 14, when all this began for me, about 100 urethral dilations. And I came to learn through all those procedures that for me, the best thing I could do was drink a really big glass of water. I mean, when I don't mean a gallon, I just mean a glass of water, right? And when I felt the need to pee, to just bite my lip and pee it out all at once. What I found is that stopping and starting, it's like pee a little bit out, pee a little bit out, pee a little bit out. That just extended it longer. And so for me, and I'm not saying this is right for you, but for me, I just learned to kind of plow through that. It's just bite my lip and I just peed without doing the stopping, starting. And that seemed to make it go away a little bit more. But doctors are better at doing that now. I'm talking about instruments that they used 40 years ago that were big. The instruments that they use today are much smaller. And I don't think you would have that same level of pain that I did as a kid. Uh-oh. Oh, God. Okay. Here, hold on. Hold on. I gotta plug in my phone for Instagram. Yikes. Yes, trust this computer. Ah! Oh, it wants to do a software update on my phone. Okay, that's not a good idea. Okay, I'm going to say not now. Okay. Let's see. Hold on. DJ also says, do you think it's necessary to do it again? I mean, I think it's useful information. Dr. Day also requested a meeting with neurology since you were diagnosed with small fiber neuropathy. Which subset does that fall in? That falls into IC subtype 3 central sensitization. I have small fiber polyneuropathy too, which is why my skin can be so sensitive. And again, that's really where something like PEA would shine, because that's completely controlled it with PEA. Also, DJ says, I'm in such pain when they press muscles, but mine are a hot mess. Okay, so that's really, really important. If they touch muscles and you have pain, then that's really actually a good sign, because that means we know where we're working. Now we have to figure out why you're in so much pain. What's wrong with those muscles that are keeping those muscles so tight? And so just know that physical therapy should not hurt. I mean, you should not be in agony when they do physical therapy. There might be a, kind of, I mean, it never hurt me. And my muscles were really tight after my hysterectomy. I didn't feel the discomfort until as I was walking out of physical therapy and sat in my car. That's when I felt the most pain from physical therapy. But you just need to really communicate with your physical therapist, tell them where the pain is, and they need to work on that. Now, there is, for example, we have a member of our Facebook group, Sue, who diagnosed with IC. In fact, she was at our last meeting, diagnosed with IC for decades. Bladder therapies never fixed her. And then when we started learning about pelvic floor physical therapy, she went to pelvic floor physical therapy, and it was always painful in one spot, which is, I always say, if you got pain in one spot, we have to figure out what's at that spot. And in her case, it was at one spot. And so she finally went to see Dr. Ken Peters, who again is one of our top doctors. And you know what he found is deep in her pelvis on one side, a massive growth of scar tissue that was kind of weaving through these muscles. So the reason why pelvic floor therapy was so difficult for her was because she had a giant equivalent of a benign tumor of scar tissue right here. And it was a very odd, rare presentation. She knew exactly when it happened. She'd fallen off a horse. And that's exactly when it all began for her, this massive fall off of a horse. And so it's informative that it's painful. Now we have to figure out why it's painful. Rose says, does the AUA guidelines have any guidelines for skin gland infections? I don't know. Let's look. I'm going to auanet.org. This is the largest urology association in the world. And I'm clicking on guidelines, which is in the main menu. And let's see if they have skin gland. They have guidelines on recurring UTI. No, they don't have it on that. Hi, Barbara. Prasid said, how'd my dad's birthday go? It was fantastic, you guys. Thank you, thank you, thank you for all the cards you sent for my dad's 100th birthday. He really felt special, and that was good. After 3 years of COVID with hardly any visitors, I was really baffled as to how to try to celebrate his birthday with him. And it went perfectly thanks to you guys. Thank you, thank you, thank you, thank you, thank you, thank you, thank you for helping us celebrate my dad's 100th birthday. Curtis said, I had hemorrhoid surgery about 15 years ago. I wasn't able to urinate all day afterwards, so I had to come back and they put a cystoscopy in me. I have red spots on my bladder wall, I believe. So they've thrown those red spots out as being meaningful. That when they do a hydrodistension with cystoscopy and they stretch the bladder, that's what any bladder will do, develop red spots, because your bladder is not supposed to be stretched like that. So if you look at the new AUA guidelines, Curtis, they've thrown those out as being meaningful. Kayleen says, your mom wants my scarecrow. No, it's mine. I'm very visual. I have to have lots and lots of decorations up all year round. I'm a color girl, and I get comfort. I get comfort from having things like that. I just get comfort. All right, let's come back to Instagram. What would help with the horrible bladder pain that radiates to my back? Well, pain that radiates to your back is often from your pelvic floor. And so it would be interesting to see if a muscle relaxant would help, Red Sox. Otherwise, we have to ask ourselves what would turn it off. An anesthetic cocktail would be fascinating. A heparin lidocaine installation, if that turns the pain off, that's telling us if it's your bladder wall. If it doesn't touch it, then it tells us it's not your bladder wall, that there's something else going on. Pain that radiates towards your back, we're really going to be looking at muscles and or UTI too. Bearis says, I'm scheduled for my first hydrodistension and pudendal nerve block. I just want to know once and for all if my issue is bladder wall or not. I'm a little nervous. My urogyne's doing it. So if you're going to have a hydrodistension, just verify that they're going to do low pressure, short duration. We don't want to overstretch the bladder and over time. Our new guidelines, we no longer do that. We go for a minimal procedure to minimize trauma to the bladder. And so it's good data. I'm not against people having hydros. You just have to have it done in the right way. I mean, there comes a point in time where we want somebody to look. If you've had pain over a year and you're not getting better, it's time to let somebody look. Jenna says, my children were having health problems and she was incredibly stressed. Here's the thing. High levels of stress at the start of IC or even before IC begins, very, very common. And now we understand the mechanism why, because if you're in long-term persistent stress, your brain is in fight or flight. And what happens when your brain's in fight or flight? You tighten your muscles. Also understand that pain that is accompanied by anxiety will be intensified by the brain. Pain that is accompanied by laughter will be minimized by the brain. Hi, Tarj. Hi, Allison. Hi, Angela. Hi, Barbie. Hi, Deb. I'm wondering if stress triggered it and my tight pelvic floor isn't allowing it to heal. Yeah, as long as your pelvic floor is tight, that's a problem. Hi, Thorn. All right. And you guys, bear with me here. We're simulcasting on YouTube. And when I'm looking down here, I'm looking at Instagram. Curtis says, I believe you said in a previous chat that maybe pelvic muscles were damaged in surgery. Absolutely. They can certainly be damaged in surgery. Angel said, trying to get caught up here. So I'm glad I got Bladder Builder ordered. Bladder cysto showed rare clusters of cells that didn't say anything else. COVID acute symptoms since May, 4 times before, and you had physical therapy 4 times before cysto. So again, Angel, COVID cystitis is a whole separate beast that we're all really trying to learn about. Anne says, do we have a separate site? Yes, hunterslesions.org. Kayleen said, how many cards did we get? Actually, we got over 100. I have a lot of the envelopes right there. We got cards from around the world. We got cards from Australia, from New Zealand, France, England, and I think almost every state in the country, Canada. It was great. And the night before, we sat at the kitchen table and the 3 of us opened them. Like my dad had the razor, then I opened them, and he read every single one of them, and we're still getting cards. It's been really, really wonderful. And what's really cool is even some veterans, older veterans who saw my post, they're sending him cards. Which is just you guys, you have no idea what this did for my family. I am so grateful. Thank you, thank you, thank you. Cora says, I've been going to pelvic floor physical therapy. She hits my obturator and turnus on the right side. I have constant burning pain. However, after physical therapy, I get 24 hours of no burning, then it comes back. So that's great. Okay, so Cora, that's fantastic, because she is now proving that when you restore muscle position and muscle health, it goes away. The challenge is that when you get back home, your muscles get tight again. Is it because you're going up and down a lot of stairs? Is it because you're under stress? I mean, that's exciting. That's really, really exciting, because now she has proved that your tight muscle is causing all of this pain. And so the challenge here is trying to figure out why your muscles go back into tension. Are they going back into tension again? Are you going up and down a lot of stairs? That can do it. Do you have one leg longer than the other? That could do it, because that's going to tilt your pelvis to one side. And so you really have to walk out of those appointments looking at what you're doing. Looking at what you're doing. Are you wearing heels? Are you wearing flats? Is there anything that's putting any long-term or weird pressure on your pelvic floor? I mean, listen, once you have tight pelvic floor muscles and pudendal neuralgia, you're done wearing heels. That's too hard on your pelvis. And so we have to look at the wear and tear issues now. And I feel terrible for the girls growing up who are wearing these massive heels, like these 7-inch heels. Holy hell. I thought when I was in my 20s, this was big. This is what Princess Diana wore. Now it's like double or triple that, and it's crazy. And the damage that's being done is so sad. Kayleen said, "I'm so happy to hear. We can't give you as much." Oh, honey, thank you. Thank you. Yeah, I couldn't, I was just last Sunday, was the day after we had our little family party, and it was like the day after Christmas. We were all exhausted. And I couldn't do anything. I just literally, because I'd cleaned for 4 days and see, my tooth is hurting. So for those of you who came in late, I have terrible luck. I have terrible luck. A week ago last Friday, I went to have my teeth cleaned. And I walked in, I pulled up to the dentist and I was going, God, I feel really good. My teeth feel great. My jaw's in alignment. My TMJ was under control. I walked into that appointment going, oh, this is great. I walked out of that appointment with a damaged root because she overdid the water thing. At the molar, like next to my eye tooth, will be gone on Wednesday. It is completely destroyed. And now it's infected. That's like, oh, come on. No. The worst luck ever. It's ridiculous. And I have dental anxiety anyway, right? I'm the only person. My dental anxiety comes from when I was in my 20s. I broke a tooth. I had an emergency. I did an emergency root canal. I had a 8-hour root canal by a doctor who left every 15 minutes to go snort coke in his office. I kept wondering why he kept getting up. Oh, he was busted the next day for dealing coke out of his dental office. I was his last patient before he got busted. And I was so traumatized by that I have dental anxiety already. So it's like, oh, are you kidding me? But the rule is, like, I knew something bad had happened, like within 48 hours. I knew it. And of course, my dentist was out on vacation. I made an appointment with an endodontist on Friday. And she goes, you don't have a referral? And I went, no, I don't have any referral. I'll tell you exactly what happened. Here it is. 10 minutes. She goes, yeah, you got a fractured root. The cleaning was too aggressive. So I made an appointment with the oral surgeon for Wednesday. So wish me luck because I won't be able to eat on Thanksgiving. But anyway, I feel fine. I feel fine about it. It's like, I know what it is. I've been through it before. I'm not worried at all about having my tooth taken out. I'm just worried you're going to see it. You're going to see a missing tooth right here. And it's like, come on, $5,000 for implant and crown? Life. John says, I've noticed that omeprazole gives significant reduction in bladder and urethral pain. Have you heard of that? Yeah. Yeah, because it's an acid reducer. So the reason why a stomach medication might make you feel better is because it's reducing the acid production in your stomach, which is then going to reduce the acid that's reaching your bladder. But it's not fixing anything. It's not constructively repairing your bladder. That's what I call chasing your symptoms. And, as long as there's no risk for it, the challenge here is every medication has significant side effects. Significant. And so you got to weigh the pros and cons, but I don't like the idea of chasing symptoms. I like the idea of fixing the underlying problem. And so we really want to try to understand what is driving this in the first place for you. And again, 85% of IC patients have tight pelvic floor muscles. What have I been saying for the last 5 years? Now confirmed at the latest National Institutes of Health meeting. 85% of IC patients have tight pelvic floor muscles. Our biggest subtype is pelvic floor. It is not bladder wall. So we got to do the pelvic floor work. Hi, Go Hudson. Renee says nobody cares. They should pay. Yeah, I have an appointment at 9:00 with that dentist. I will be her first appointment from her coming back from vacation. And I got to figure out how to handle that. Because I walked in pain-free and I walked out with a destroyed tooth. And I do not believe that I should be paying for this. So, it'll be interesting to see what she says. John says, are the softer silicone wands okay to use? Sure. You just have to be able to get good tension on it. So like for me, it's fascinating how muscle tension moves around in the pelvis and in the pelvic floor. I have moments when my left piriformis up deep is very tight, right? So again, I have moments when I'm very tight up here. And so I know what to do. But I also have, if I'm ever having rectal pain, and you guys know what you know what I mean. Your rectum just starts to burn and gets uncomfortable. That's when we have to work with the shallow muscles. These are the levator ani muscles, right? And so I will be working exclusively very, very shallow. And there are some moments when, I just use the tip and I will put a lot of pressure on that side to get that muscle to release. But you have to, I've done this for a couple of years now. I know what I can do and not hurt myself. So you just really have to kind of finesse it a little bit. Prasid said, my bladder installations are giving me tremendously good results. Now I've started reducing your Elmaron dosage. Good. Excellent. I think that the first Elmaron lawsuits go to trial in January. I think this coming spring. They were originally scheduled for October, but I think they got pushed back to January with COVID. So for those of you who don't know, Elmaron, which is the only oral FDA-approved medication for interstitial cystitis, granted, this was before we had subtypes and we knew these groups. This was back in the 90s. Elmaron has now been associated with significant retinal disease that they call it pigmentary maculopathy, that areas of the retina in your eye change color, pigmentary, and those areas then become damaged. And some patients are now legally blind. So it's been a devastating development for the IC patient population. I'm the one who broke that story. We did our own research and our own survey. And in our survey, we have more than 2,000 patients in our survey. 54% of patients using Elmaron show changes in their vision and retina damage. 55.4. Now, that's my survey cannot exclude genetic diseases, hereditary retinal diseases. In the clinical studies that have been done, it's more at about 20 to 25%, if I remember correctly. But let's just go see, just out of curiosity, if we have any new research on that. Pigmentary maculopathy. Hold on. Most recent. Let's see if we have anything new. Age-related macular degeneration masquerade, a review of pentosan polysulfate maculopathy and implications for clinical practice. And they talk about the new FDA warning. So they're concerned that patients have been given a different diagnosis, like hereditary maculopathy, when in fact it is maculopathy caused by the medication. And there's a big Macula Society collaborative study. Here's somebody, pentosan polysulfate maculopathy, originally diagnosed as pattern macular dystrophy. Not a lot of new research. We only have 2 studies released this year. Donna says she remembers when you gave us the news. I was crying. I mean, it was over Labor Day, and I was just, I'm a geek. And I was just cruising the National Library of Medicine looking for new stories that I could do in our magazine when I came across the original letter to the editor from the researchers. And then I bought the article and I just started sobbing. It's like, oh my God, I personally know thousands of patients who use pentosan who can now potentially develop blindness. But it was a real, moment in time because number one, I read it all, and then I sent an email to the top IC doctors that I work with, and I said, "Do you know about this?" And then I said, well, this makes no sense. Why would there be a connection between an eye disease and the bladder? Let's credibility test this. Let's do a survey. And so Robert Maldwin helped refine my survey. I sent it out to 30,000 patients. And the first phone call I got 20 minutes after I sent out the email was from a patient crying who said, "Oh my God, now we know why I'm going blind." They were trying to figure out why she was going blind. She had every test you could have, and she was an Elmeron user. But there was a real moment in time where, it's not like I have a lot of people to talk to here. And what's baffling is the ICA, which is the other IC group, I do not believe that they've ever talked about this or made any sort of public statement about that. It would be real nice if we could all collaborate together and decide how to handle this, but it's not real. It's just not the way it happens. And so I really had a moment here sitting at this very desk that I'm sitting at now going, oh my God, what do I do? Do I tell you about it or not? Because it was early, right? It was a suspicion. We had early data, but it wasn't necessarily proven. It's certainly proven now. And I knew sending out that email would affect everybody. And believe me, I did not approach that casually. And what it came down to is I chose to send that out like within a week of this whole thing because I believe in informed consent. You have the right to know that a medication you're taking could harm your eyesight. You have the right to that information. It was in the public domain. It's just you don't read eye journals. And so I chose to launch that story, and it changed the entire IC movement, and it scared a lot of people. And do I regret it? I regret ever having to tell you that the only oral approved medication for IC could change your eyes. But you have the right to know. I could not imagine sitting on it for a year. I thought you guys would have gone, I could have stopped it in a year, Jill. Why would you not do that? Why would you not tell us? So I told you guys within a week of learning about it. And that was probably the hardest decision I've ever had, running the IC movement, running the IC network. So DJ said, I had a radical hysterectomy. Losing my cervix wasn't planned at 33. Yeah, I lost mine too. When I woke up from anesthesia, I immediately felt like I needed to pee. I spent 3 hours in the bathroom and they sent me home. You know, my husband died unexpectedly, and the pain that I thought was going to be gone, since I thought my endometrius would be gone from my hysterectomy, never happened. Instead, you were diagnosed with IC. Oh, DJ, this is one of the challenges that we have, is that if you walk into any doctor, any different type of doctor, with the symptoms of frequency urgency, you're going to get lots of different diagnoses. You walk into a primary care, they're going to go, wow, you probably have a UTI. You're going to walk into a urologist, and they might go, maybe you've got overactive bladder. You walk into a gynecologist, and they go, well, maybe it's a problem with your uterus. That's one of the fundamental challenges that we have in the IC world, is that the symptoms can be so easily misinterpreted. And that's why we have guidelines, and because we need to teach doctors how to differentiate different types of pain, but how to diagnose it correctly. And that's why we're in such a good place, because now we're doing subtyping. So the future is going to be much better for newly diagnosed patients now. We're not going to waste time for them. You're not the only person who had a hysterectomy and it didn't fix it, or he had a hysterectomy and it caused it. It could be estrogen atrophy, it could be surgical trauma, it could be muscle issues from that. DJ says, what I called my first flare now, it took 5 hours to go 90 minutes home. I had to keep stopping all the time. This was my first flare. I thought it was from the clips on my ureters during the surgery. It wasn't a flare. I wouldn't call that a flare, hon. I would call that post-op recovery. That's not a flare. That's a fresh surgery that 30 years ago, 40 years ago, you would have spent the night in the hospital. But now they send us home. Like, I was home, 2.5 hours after I arrived at the hospital for my hysterectomy. I was ridiculous. And I lost my cervix too. So I would not call that a flare. I would call you a surgical injury patient, that something happened during that surgery which changed something. And the question is what? Normally when they do a hysterectomy, they do a hydrodistension with cystoscopy afterwards to look in your bladder to make sure they didn't cut your bladder. Something happened during that surgery. The question is what? And I would really want to look at the surgical notes if I were you. For example, did you have blood in your urine afterwards? Because if you had, anytime you're sent home with a catheter after having a hydrodistension or surgery, that usually means that the bladder has been damaged in some way. And it's amazing the doctors who don't explain that. But if you're peeing blood, your bladder was injured in the surgery. DJ says, from what I've learned from you, I touch 3 to 4 subsets. Also, we can't get lidocaine for installations here in upstate New York with the heparin, but I can't thank you enough for giving me that knowledge. Oh, honey, you're welcome. And I'll help at any time I can. But honey, if I were you, I would get a copy of your surgical notes, because that's, cause and effect. You didn't have these symptoms before the surgery. You had the surgery. It's like me with my tooth. Your symptoms started immediately as you woke up. So something happened in that surgery that caused this. So the question is what? And the surgical notes, I think, would really help. And you're entitled to those. Prasid says, Jill, my IC is overlapping with functional dyspepsia now, along with IBS. Any tips on how to deal with this? I'm happy that my IC is getting controlled with diet and installations. So, hi, Mama Bear. So when you have chronic overlapping pain conditions, you have central sensitization, right? The nerves throughout your body become more sensitive, which is what drives that sensitive skin, that wicked sense of smell. So this can happen after trauma. This can happen after surgery. This can happen after abuse. It just happens. 14 days of pain will put that brain into fight or flight, which will trigger central sensitization and nerve sensitivity. And 21 days of abuse, regardless of your age, will also do the same thing. So the nerves in your bladder are sensitive. The nerves in your bowel are sensitive. I'm exactly the same way. The nerves in my skin are sensitive, and the nerves in my stomach are sensitive. So, I had about 10 years ago, I remember exactly what happened, because maybe 15 years ago or 12 years ago. I was doing a workout at the gym that I belong to, because I'm a gym rat, or I used to be a gym rat. Used to love going to the gym. And I was on a treadmill and I belched, and that I felt like I had pressure in my stomach and it was uncomfortable. I just started belching. My stomach was very full of gas. And to make a very, very long story short, I stopped eating. I stopped eating. I got to the point where it was so bad I couldn't even drink water, and I ended up in the hospital. And I looked like a skeleton. I mean, it was bad. And I was diagnosed with gastroparesis. They did, and it's just a long, drawn out drama. It should never have taken as long as it did. I mean, if you're belching, that means that food is sitting in your stomach that's fermenting. If you ever make yeast bread, what do you do when you're preparing yeast? You put it in warm water and you give it sugar and it starts to bubble, right? Well, that's happening in the stomach with people who have delayed stomach emptying. And so when I had my test, my breakfast was in my stomach at 5 o'clock in the afternoon, because the nerves in my stomach had basically massively slowed down. And so it became, I healed, and I'm way better now, and I can eat now. Obviously, cinnamon rolls have never tasted better. But to get through that and to kind of heal those nerves, I had to eat very small meals. I could not eat a regular meal. I would eat like a bite every 45 minutes, which is why I actually closed my IC Network corporate office and moved it home, was because I couldn't do that at work. And so very, very small meals over time. And there you go. And learning the foods which produce a lot of extra gas. You couldn't pay me to eat cabbage. You couldn't pay me to eat Brussels sprouts. And I don't eat greens. If I eat greens, sit in my stomach and ferment like mad. I do not eat lettuce. I do not eat spinach. And I'm so much better for it. And this is very common in people who have gastroparesis. I eat a ton of salad. I just don't eat lettuce. I eat carrots and I eat beets and I eat avocado and I eat cucumber, peas. I can do those. I just don't do leafy greens. And my stomach is way better for it. But hold on, let me get it. Ow. Oh. Gaviscon is the bomb. It's the bomb. And this is what my gastroenterologist wanted me to use, because rather than my Lanta or anything at all like that, because I mean, it's just a chewable. It tastes fine. It's a little tiny bit foamy. And so it leaves a foam on the top of your stomach contents so that the gas won't come out. And so I will, this is our lifesaver. And it turns out in my family, it's pretty genetic. My grandfather had this. My father has this. I have it. My brother has it. My sister has it. Just this weird delayed stomach emptying. So I have to wonder if you've got a little bit of that going on. I always ask patients, are you farting or are you belching? If you're belching, then that points us in the gastroparesis direction. If you're farting, that points us to more irritable bowel. Renee says, you got your notes. They did fill the bladder after the surgery. You had to go home. Oh, wait. Renee, she went home with a catheter. Okay. Yeah. So you got to get your surgical notes, hon, because that's not normal. That means that they damaged something, that they damaged your bladder. I did not go home with a catheter. I had my hydrodistension. My bladder was fine. I did not need a catheter. When you're sent home with a catheter, that usually means something's happened, that your bladder's been affected. I've worked with patients who have had a stitch perforate their bladder. I've had worked with patients whose bladders were cut by the scalpel or whatever they were using, because they do it laparoscopic assisted now. But the fact that they were sent you home with a catheter is very, very compelling here. DJ says, I have gastroparesis as well. I'm a type 1 diabetic. So the three diets together are contradiction. Yep. Prasid said, I've got both. Rose said, I want to thank you for giving me some ideas. Excellent. Hi, Joanne. B. Russo says, if you're getting estrogen injections, do you think it's necessary to take vaginal estrogen? Well, the problem with a systemic estrogen therapy, whether it is an implantable or whether it's a pill or an injection, is that estrogen is distributed throughout your body, which then raises your risk of, especially if you're older, of breast cancer, cervical cancer, uterine cancer, ovarian cancer, etc. So topical estrogens are considered much, much safer because the estrogen stays in the skin. It stays in the skin exactly where you need it to be. And there's a lot of new research in the last couple of years where they continue to confirm the safety of topical estrogen, even in women with a history of estrogen-driven cancer. So if you go to PubMed and search for, well, here, let's just do it. I'm already on PubMed right now anyway. Here we go. Topical estrogen safety. Let's see here. Actually, that's not the right way. I should search for it. Topical estrogen breast cancer. Let's just search that way. Sex hormones related to ocular dryness in breast cancer. You'll just have to search through that. You know who you should follow if you're on Twitter. Follow Dr. Rachel Rubin, Rubin, and Dr. Jen Gunter. She's Dr. Jen on Twitter. And who's the other one? Oh, I'm zoning. There's one other one. You can go to my Twitter page and you can see who I follow. But that's where I get all the latest research now, is actually from Twitter, which is heartbreaking because who the hell knows what's going to happen with Elon Musk. I don't even want to go to the platform right now, but that's where everybody connects. That and LinkedIn is where the doctors and everybody connect. So also in this magazine, the other articles that I have in here, let's talk a little bit about some of the new research. First of all, we have an interview with Dr. Sonia Balani, who's a pelvic pain specialist who specializes in treating men and women with pelvic pain. And I have a very, very detailed, fabulous interview with Dr. Anina Imhoff, who has a doctorate in physical therapy, and she just opened up a new practice actually here in my county. And wow, I mean, like if you're worried at all about physical therapy, you're not sure what to expect. This interview with her is incredible. I've never had such a thorough, really outstanding interview on pelvic floor. Like, what should patients avoid as they strive to protect their pelvic floor? Dr. Imhoff says patients often want to know what types of activities and exercises are safe and which ones to avoid for their pelvic health. I wish there was a cookie cutter answer to make this simple for everyone, but the truth is that it's highly individualized and based on a person's mobility, strength, tissue health, and personal goals. Many patients have read that they should never ride a bike, do squats, go running, have sex, or a number of other things. I have a big problem with this type of misguided blanket statement advice because it ends up creating a great deal of fear and hopelessness. These activities can trigger some types of pelvic pain, but most patients with pelvic pain are able to do most of these things just fine. It's all about working with a physical therapist. What she does say here is avoiding constipation by consuming a healthy amount of liquid and fiber each day is important because constipation can cause excessive strain on the pelvic floor, the walls of the rectum, and against the bladder. We should also avoid straining during other activities such as lifting, reaching to unload. Oh my God, by the way, I had a patient call me who literally went back to work 2 weeks after having a hysterectomy, and she was lifting heavy weights and was bleeding. And it's like, woman, didn't anybody tell you you're not supposed to lift anything heavy for like 6 months after hysterectomy? No, she didn't know. And she was bleeding a lot. And it's like, you've ruptured it. She didn't understand that the stitches from a hysterectomy are 3-month stitches. I ruptured a stitch bending over and picking up a t-shirt, for God's sake. And that was 6 weeks after my hysterectomy. You really got to follow the doctor's recommendations after hysterectomy. You cannot lift heavy things. Anyway, we have an article on differentiating between UTI and flares. Also, the new research on hyperbaric oxygen therapy for patients with Hunner's lesions. If you're not responding to fulguration, steroid therapy, hyperbaric oxygen therapy is showing great promise now. So what is hyperbaric oxygen therapy? It's really used for people with the bends. If you have a scuba diver who's come up from depth too quickly, they get the bends. Or for burn victims like Jay Leno right now. In fact, I saw a picture of him. I think he was in a hyperbaric oxygen therapy tube. So they basically put you in a pressurized oxygen environment, whether it's a hollow tube that you're laying in or a room where you're wearing a mask, and you get a significant more amount of oxygen than you normally would. And it's diffused throughout your entire body, and it massively improves healing. So anyway, there's this research started in Europe. Now it's happening in the United States. Dr. Ken Peters' team is doing research. There's researchers in San Diego are doing more research on it. And it's working the best for patients with Hunner's lesions. It's usually done as an outpatient procedure. Yeah. You just have to understand the biggest risk with hyperbaric oxygen therapy is oxygen is very flammable. So you're not going to wear any metal, and they're going to be very, very careful about your safety. All right. Then we have my latest, very geeky, the latest IC research. So let's just kind of go through this real quick. So remember that there are a group of people who keep telling IC patients you all have infection. And it really kind of drives us all crazy because anybody making blanket statements like that, clearly they're not working with the IC patient population. And we have a new urobiome study that looked at the healthy biome in normal people versus the bacterial load in IC patients versus the bacterial load in incontinence patients. And guess what? Our urobiome is normal. It's normal. The people who had altered urobiomes were the patients with incontinence. That was very interesting. So that really, again, throws water on the theory that we all have recurring infection. And that was research published in Frontiers of Cell Infection Microbiology. Okay. We also now know that central sensitization is common in pelvic pain patients, that widespread pain. Another article establishing that pelvic floor tension is a distinct subtype. Electroacupuncture, that's very interesting, shows more success than traditional acupuncture. Transvaginal light therapy improves some symptoms in IC. This is done by Chip Buttrick, a very, very well-known IC researcher. But the research study that I thought was the most interesting and really quite tragic was how men and women differ after they've been diagnosed with IC. And I was shocked. A recent study sought to identify gender differences in men and women with IC. 37 participants, 27 women, 10 men, participated in an 18-month study. So women reported greater pain intensity, but not greater impairment. Both genders reported significantly elevated levels of stress. Men were diagnosed more quickly than women. And men did not, they used the term recognize or deter stress, while women felt overwhelmed by the stress of a diagnosis of IC. Men requested more physiological treatment options, while women needed more social and emotional support. Men felt supported and involved in their treatment decisions by their physicians, while women reported feeling dismissed and disbelieved. And that, my friends, is a very, very true. We've all had those moments where we have gotten the "Are you crazy?" look from our doctor. Are you sure? And from family members. I think that this speaks to the underlying perception that women are emotional, and the reason why we have bladder symptoms are we're emotional. And we know that because that came from a study published in the 50s. IC was discovered in the mid 1800s. It was validated in the early 1900s. We knew it affected men, women, and children during World War II in the 40s. But then two pricks of doctors, urologists, published a paper of a young IC patient who claimed that she had unexpressed anger manifested in the pelvis and referred her to psych therapy. And from that moment all the way up to 1990, pretty much medical schools taught that IC was a hysterical and emotional disease. I mean, we're talking 30 years ago, guys. 30 years ago. That's not that long. Now, of course, that's all been thrown out. We put $100 million, probably $200 million into research from our government at this point in time. We know it's real. It's not emotional at all. But we're dealing with the ripple effects. We're dealing with the ripple effects of older generations of doctors who were taught that this was emotional, who were taught not to believe women, who were taught to refer patients to psych because they had frequency urgency. And this is something we're working very, very hard to fix because it is a great tragedy. You know, I was referred to psych at my first appointment. Hey, I'd really like you to go over to psych and talk about mindfulness. And I yelled at my doctor and said, no, I'm peeing all night. This is not all in my head. I need help with my bladder. Now, he was right in a way, because what he saw that I didn't see was that I had chronic overlapping pain conditions, IC, IBS, vulvodynia, sensitive skin, all that sort of stuff. And mindfulness really helps that. I just wasn't ready to hear that. I understand now that my presentation was not a bladder wall presentation. My presentation was a pelvic floor central nervous system presentation. And his suggestion for learning mindfulness was absolutely correct. But this does not imply that this is mental illness. This is injury. It's injury or trauma. It's injury or trauma to muscles, and it's injury or trauma to the nervous system. DJ says, I was in the ER. I was still met with that exact message not 5 years ago. I mean, it was like literally only 4 to 5 years ago that the first IC question was actually put on the medical board exam. I mean, this is why, I always say that you need to print out the AUA guidelines. It's like 40 pages. And you need 3 copies. You need one for you that you can study. You need one to give to your doctor, and you need one in your car for any moment where you go to a new doctor who says IC isn't real. If you go to the ER, you bring the IC guidelines. You gotta listen, it's our responsibility to make it better for future generations. We have to be the educators here. We are the educators here. We are. Your primary care doctor is not going to go to a urology conference and take a class on IC and pelvic pain. They're not. They're relying on an old textbook that says this is all in your head. This is why you have to be proactive, assertive, and aggressive, but not insulting or mean. And say, hey, I don't know, but did you know that the AUA issued updated guidelines for IC in June of this year? And in the new guidelines, they don't call it a bladder condition anymore. They call it a pelvic pain syndrome with a neuromuscular origin. Here is the copy, because I think you're going to find these absolutely fascinating. Because the challenge that we have here is that you're attending a lecture on the internet taught by a woman in California. And I'm not a doctor. I mean, I'm a support group leader. I have a lot of medical training, but I'm not a doctor. I can't give you medical advice. And so they're going to say, oh, you can't believe anything you read on the internet. And they're right. They're right. You got to be really careful with the stuff you get on the internet. This is why you go to auanet.org. Their urology association. It's not the internet. It's their group. You go to guidelines, you click interstitial cystitis, and you print it out and say, well, you know what? I didn't get it from the internet. I got it from the American Urology Association. And they can't do that. They can't do that because they should read these, right? Look at this. I'm dehydrated. Can you see my fingers? I'm on this new blood pressure medication, a water pill. I got to drink some water. Hold on. What am I drinking? This is a iced coffee made with Dandy Blend herbal coffee. So ice, a teaspoon of Dandy Blend herbal coffee, which is my favorite. It's so freaking good. With coconut milk and a little bit of vanilla coconut milk, no sugar. You can blend it up and you can make a frappuccino, or you can make an iced coffee. So for those of you who love your coffee, you got to know that, especially if you're older and you got estrogen atrophy, coffee is going to irritate your bladder regardless. Where is it? Here it is. Dandy Blend. It's fabulous. Love, love, love Dandy Blend. DJ says, I got the pre-leaf this week. Thank you. Yeah, when I sent the pre-leaf samples out, I exceeded the 1/4 inch width of the envelopes that I sent it out in. And so about half of them got returned for insufficient postage. Instead of putting 2 stamps on it, they wanted $4 for the samples. So I had my staff open the envelopes, take out. I gave you like 20, 25 samples, and you ended up getting 3 or 4. So Tabby says, is there a safe collagen powder or drinkable collagen available? Yeah, I've got one. Where is it? Hold on. You know, I look at collagen as kind of like one of those internet fads. Companies are making a lot of money. So I haven't used a lot of it. Unfortunately, it does have a little bit of vitamin C in it, which kind of sucks. But again, it depends upon your subtype. I'm not bladder well driven, so I can do the vitamin C. So this is the one that I have, which is Vital Protein. You see this everywhere. I'm not consistent with it, though. Remember that collagen is derived from animal products, and so I'm a little bit uncomfortable with that. This one the collagen comes from cow skin. And then it has hyaluronic acid in it, which is good. So I have trouble. I have a little bit of trouble with emotionally accepting that I'm eating cow skin. DJ says, how does your doctor get a look at the outside of your bladder? Through a laparoscopy. And also, guys, for anybody, we have new pre-leaf now. So Pre-Leaf is a fabulous sponsor of these chats and has been sponsor of many IC activities for the last 25 years. I mean, they're really steady. And just the new company that has Pre-Leaf, DSC Healthcare Solutions, is just divine. They're so wonderful. So they have now brought back Pre-Leaf powder, which they are calling Stirrins. And for anybody, so it's just, you can just pour it into a cup of whatever you're eating or drinking that might be more acidic. There's no flavor to it, and it will immediately neutralize some of the acid in that. And so we've got Thanksgiving coming up, and if you go to grandma's house and she always insists on lasagna, and you're like looking at it going, oh crap, how can I eat that without my bladder screaming at me tonight? This is where Pre-Leaf really shines, because Pre-Leaf can reduce the acid level of the food that you're eating up to 95% of the acid just by one packet. So it's been around for a long time, but it's not candy. You don't eat it all day, every day. You only eat it or take it before you're going to eat something acidic, because it is calcium. That calcium has to go somewhere. If you do too much of it, you might end up provoking calcium kidney stones, which would not be a good thing. John says, does a diuretic bother my bladder? I find them quite irritating for me. No, but I'm on like the lowest dose of hydrochlorothiazide. And they basically said I didn't even need to take it. So my blood pressure was 150 over 100 three months ago. Like I was going in for my sinuses and they went, wow, your blood pressure's high. And I'm like, holy crap, it was. And I did that normal deep breathing and it stayed high. And I went home and it was 150 over 100 every day for a week. I was shocked, but my stress levels are very high caring for my parents. My dad has moments when he gets a little bit combative, and that's very hard for me. So I did some reading. And what I didn't know is that 30 to 50% of menopausal women develop high blood pressure because the loss of estrogen makes our veins and arteries stiffer. I mean, but also salt intake. We become much more sensitive to salt. So I got rid of all the salt, and I love salt. I was eating very salty popcorn every single day. I ate Lay's potato chips the night before I went to that appointment. So I got rid of all salt, and I started walking every day. I've lost at least 10 pounds, probably more. And I was able to get my blood pressure down to, in the like high 120s, low 130s. But every now and then it shoots up again, just again, stress. So, I mean, the cardiologist, I had a stress test. I was fine. I just realized with the stress test, I hadn't done any aerobic activity during COVID. It's like, oh, you need to start exercising again, which I did. So anyway, they just gave me the lowest dose. And I'm not even taking my blood pressure now. I just, it scares me too. I get scared. It really triggered, like my anxiety for the most part has been really controlled for the last 25, 30 years. There's just something about that high blood pressure and it just forced me to confront my stress level. I mean, my stress level is really high. That's what happens when you care for a 100-year-old and a 93-year-old and you run a business. So I just don't like taking my blood pressure now. I'm doing everything right. The cardiologist said I was doing everything right. They were thrilled with my blood pressure diary, so I'm good. But I'm not going to scare myself by taking it every day anymore. They told me to stop, so I've stopped. OCD, anybody? Tabby says, I know pear juice is safe to drink, but it has ascorbic acid. Is there a safe drink or a good place to order it from online? Pears in a can has it too. Yeah. So remember that in something like an organic fruit juice, they're not adding the ascorbic acid for vitamin C unless it's targeted specifically at children. They're often using the acid as a preservative. So if it's the last ingredient on the list, that really means that it's a batching issue, that for depending upon the pH of the lot of juice that they prepared, they might add more or they might add less. If vitamin C is the second, third, or fourth ingredient, that means they're using it medicinally. Hey, here, hold on. So in many cases, the acid that's in pear juice is just tiny. I get my pear juice from a organic and apple juice when I make, hot apple cider and stuff like that from an organic company, and it's pressed and there's just it's just really clean and really pristine. But again, this is where pre-leaf would really shine, because if you are feeling like your bladder's being irritated by it, you could just use a little bit of pre-leaf in it to reduce some of that residual acid, and it would probably be fine. Renee says, it'll be okay. You're tough. Just do your exercise and no salt. Yeah. Yeah. I'm going to go for a long walk after. I try to walk every day, and I'm doing long walks up big hills, most of the time. So Jeannie said, I'm having a hydrodistension coming up. I had 3 Hunner's lesions cauterized in August, then moved out of state. Urogyne sent me to a neurologist, a new urologist, and he wants to do a hydro to see why I'm in such pain. Well, this is why whenever you have a hydrodistension, it's really useful to ask the doctor to take pictures or give you a video, so that when you do move, you can actually show your new doctor the pictures, so they won't necessarily have to do a new procedure. So the fact that they have to do that, I mean, that your doctor is asking you to do that, I don't think that that's unreasonable. Number one, because you're in a lot of pain. Number two, you don't want him to guess. We need facts, and you're going to ask him to take pictures so that you can see these pictures too, right? The new doctor wants to do my first hydro. As long as he's doing it low pressure, short duration, there's nothing unreasonable about that, because to treat a Hunner's lesion, you have to have a hydro. And we know when you treat a lesion, the pain goes away in like 85% of patients. So just because you have lesions, that's real appropriate motivation for a new doctor to want to get a look at those lesions to see how they're responding. Are they better? Are they worse? Have they gone away? And if necessary, to treat them, because we know that treating a Hunner's lesion quickly and promptly will greatly reduce your pain. Whereas leaving a Hunner's lesion untreated is like the number one cause of severe pain in IC patients. Kim says here on Instagram, is alkaline water good or not? No, it's not good. It's not good. If you, let's see. So in my chemistry class, I have 2 degrees in chemistry. And I remember my chemical safety training, my very first class at Santa Rosa Junior College, inorganic chemistry. They were teaching us about chemical safety. And what the lab director said is, bleach will eat your eyeballs out just as quickly as sulfuric acid. This is chem lab humor. Obviously, something that's very, very acidic like sulfuric acid is going to cause very, very bad damage. This is what's scarring so many young women in the Middle East. Are men who feel rejected, and they try to scar them so that they're not pretty anymore. Sulfuric acid is devastating. But have you ever spilled bleach on your hand? If you ever spill bleach on your hand, it gets very slippery. Why? Because the bleach, which is alkaline, is also dissolving your skin. So urine is not alkaline. Your goal is to drink things that are pH neutral. And that's really going to be spring water. Spring water is the best water you can drink. But alkaline water every day, you're just pouring bleach on your bladder. That's not good. Good night, DJ. Have a good dinner. Jeannie said, even though he's a neurologist and not a urologist, I didn't know neurologists did this. I think that's very unusual. I thought you were just getting a typo. I thought it just, your words combine new urologist. I would be very cautious about this. I would ask technique. How do you propose to do this? How many hydrodistensions have you done? How do you propose to do this? Will it be high pressure, long duration, or low pressure, short duration, as recommended by the American Urology Association? And if he is unwilling to answer that question, if he says, don't question my methods, I will do what I will do, I would not allow that doctor to do that. I personally wouldn't. The guidelines are very clear, and we knew from the first release of the AUA guidelines in 2011, they said no more high pressure, long duration hydros. It damages the bladder too much. It ruptures bladder. It breaks bladders. So they have recommended for the last decade, 11 years now, that high pressure distensions no longer be done in favor of a low pressure, short duration. So what does that mean? It means instead of putting a lot of water in your bladder to stretch your bladder, you're doing much less, and you're not doing it under high pressure. You're doing it under low pressure. And instead of leaving that tissue water in there for 15 minutes, it's 5 minutes. So I had a low pressure, short duration hydro 6 years ago. It was fine. My bladder was not damaged. There was no bleeding. I was fine. So given the fact that he's a neurologist rather than a urologist, I think you need to be pretty assertive and ask about technique, because I would not allow anybody to do a high pressure hydrodistension anymore. They should not be done. AUA says they should not be done. Remember, you pay them, they don't pay you. You make the decisions. B. Russ says, what was my recovery time from my low pressure short duration? I don't remember any bladder pain at all from it, but it was done with a hysterectomy. And I I was on major pain meds that first week. I don't remember any frequency. I wasn't getting up to pee at night. But again, mine was post-op. So Bunte says in Germany, they are only doing high pressure, long duration. Holy crap, really? Wow. So in Europe, see, there are different guidelines in different parts of the world. Okay. And it's a very interesting story because for many, many years, the USA led all the IC research. And the Americans got very cocky. And the Americans got very condescending, to be quite honest. They were very condescending to some of the international researchers. And to the point where, they weren't facilitating good discussions. There was just a lot of arrogance back then. And so what happened is the Europeans split from the AUA. They created their own society called the European Society for the Study of IC, which is now the European Society for the Study of Bladder Pain. Hold on a sec. And so they did some remarkable things. I mean, the first thing they did is say, hey, this isn't a bladder disease for many of us. This is a pain condition. So they were the ones who stopped using interstitial cystitis and started calling this bladder pain syndrome or painful bladder syndrome, right? So that was one really good thing. Then they started subtyping very early too. And they recognized that there were different patient groups. And the way they did that is based upon your symptoms and what your bladder looked like and biopsy results. So in Europe, they require every possible patient to get a biopsy. And the only way you can get the biopsy is if you have the hydrodistension. Therefore, everybody in Europe who is suspected of having IC must have a hydrodistension. I did not know. I did not know that they were still doing high pressure, long duration. I'm shocked. Like literally. This is the last textbook that they published. And don't buy it. It's old and it's going to cost you $200. You don't need to buy it. So this was published. All the top IC researchers are the editors in Europe. So from Denmark, Belgium, Netherlands, Italy, and Sweden. So this was published in 2013. So it's definitely out of date. But and you can go, if you just Google ESSIC, ESSIC, you can go to their website. They have a good website. Here we go. Page 219. Oh, by Magnus Fall, who's like the top Scandinavian research. Let's see here real quick. Distension technique. The use, let's see, hold on. Yeah, it's not that useful. I mean, it just described the technique. Bunty says, right, and I did not want to do it. They said if I don't do the hydrodistension, they can't diagnose the IC. Well, so here in the United States, hydrodistensions are only done when the diagnosis is in doubt. So if you have frequency urgency pressure pain, if you have pain as your bladder fills with urine that is relieved by urination, that points us to the bladder wall. But also here in the United States, they want, at that very first appointment, they want your pelvic floor assessed immediately because again, now we know 85% of IC patients have tight pelvic floor muscles. And the hydrodistension is only done if they're just confused. I mean, if they suspect you have Hunner's lesions, if you have a lot of blood in your urine, if you're not responding to therapy, if you're getting worse rather than better, those are the times when doing a hydrodistension is reasonable. It's reasonable. But if you're responding to therapy, if you're getting better, and you don't have blood in your urine, a lot of doctors now would say, let's not risk injuring your bladder. Let's not risk causing more trauma. That makes sense? Joanne, let's see. Tabby says, does that same go for citric acid? Yes, it does. If it's listed towards the end, give it a try. Yes. Quantity matters. Quantity matters. If it's a first, second, third ingredient, it's a pass. If it's a very last ingredient, then it's just a pH balancing agent, and the odds of there being any significant volume are very low. Joanne says, estrogen cream, just the pea size amount makes my urethra bleed, just a scant amount. So I tried it a few times and quit. Joanne, is it? See, here's the thing. Oh, here, Dad, come in here for a sec. So you guys, here's my dad who just turned 100. So these are the people watching who sent you cards. And he went to UC Berkeley. And he's wearing the jacket I got him for his birthday because he's always cold. Can you squat down and just say hi and say thank you?
I'll show you my haircut.
How you feeling?
I just made the bed.
Good. And is this jacket keeping you warm?
Oh, yeah.
Good.
Not as warm as the other one, but
Well, it's a start.
you like this one better. Oh, sweet mama.
The advantage of the orange jacket is I can find him easier because he's a character and he wants to drive. That scares the living daylights out of me. I do not let him drive. He's only driven once in the last 3 years. And that was an emergency. Okay, Jeannie said it would be short duration, but I want to know if he finds more lesions, is he capable of dealing with them? Well, that's the other important question, Jeannie, and that is, okay, if you find a lesion, what are you going to do? Because the last thing we want to do is a hydrodistension and find lesions and not treat it, because guess what? That means you're going to have another hydrodistension that will treat it, right? And that would suck because now you have to have 2 procedures. I know I was saying something else before I saw Dad. So, and I got distracted. Sorry about that. Drinking the water. Still dehydrated. All right, guys. Well, listen, we've been doing this for almost 3 hours. I'm here as long as you want me. You got any other questions? Oh, wait. Oh, wait. Hold on. I didn't finish this. Okay. So we talked about the hyperbaric oxygen therapy. This is in the magazine. The latest IC research. Impress the hell out of your doctors if you walk in knowing the research. For the first time, we have an article on pelvic floor friendly ways to ride a bicycle. And I learned something in here I did not realize, and that is, handlebar placement is everything. We normally focus on the seat, and it's the seat pushing up into your nerves and muscles, but your handlebar, where your handlebars sit, also really matter, and that there are different things that you can do, different ways of adjusting your bike that might make riding a bicycle more helpful for those of you who are in weather, where they can do that. It was Donna says it was about the estrogen cream. All right, what was I saying? Crap, I forgot. We have articles on how to discuss intimate things you don't want to talk to anybody about. Drinking more water, and I did a new one on an IC-friendly approach to the holidays, because we are cautiously celebrating holidays again. Although now with this flu going and this RSV going around, they're calling it a tridemic. We have COVID, we got the new strains of COVID, we've got new strains of RSV, and now we got new strains of flu, which are in my family right now, the flu. These kids are all getting 104, 105 degree temperatures. So 3 or 4 days after my dad's birthday, one of my nephew's kids had 105 fever and they had to take her to the hospital. And I was just praying, please, 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 I don't want my parents to get sick. And we just said, that's it. No visitors till the end of Christmas, to the end of the year. Hi, Fiona. You know, Bunta, hi, Izzy. I was really shocked working with the patient organizations over in Europe that there are very few treatments that are approved over there. I was shocked. So having a diagnosis of IC is not necessarily that meaningful in Europe at this point in time, because the options are few and far between. That's something we're all working on. Hi, Lauren. Bunty says, how many cards? Oh, well over 100. And yes, we got your card from Germany. Thank you so much. Some of the cards were hysterical. Oh, Joanne. Okay. Thank you, Joanne. Thank you, Joanne, for refreshing my memory. Okay. So you bleed when you use estrogen. Are you using a brand name, Premarin, or are you using a compounded estrogen? I have a couple of ideas on that. Okay, so this is what would Deb, I'll get that question in a minute. I drink Arrowhead water or Calistoga water out here in California. So understand that the urethra is estrogen dependent. Okay. And so as estrogen levels drop, the urethra gets drier and drier. Those nice, thick mucosal cells kind of shrink like raisins. That mucosal barrier, that nice, what we call mighty mucus that normally protects that tissue, it just shrivels up, right? And it gets dry. And we've lost that barrier. That barrier is now compromised. So super, super dry skin, because it has no protection, is going to be much more vulnerable to chemical irritation. So it doesn't matter what you put on it. I mean, that because it has no defenses, the odds are a lot of different things would potentially be irritating. So concept number one is that it's just your skin is so dry, it has no defenses. And so again, anything you put on it is going to be irritating. But the question is, why is it tearing? Why is it causing bleeding? It could relate to the formulation. If there's more than estrogen in there, you know, if it has progesterone in there too, it's the progesterone that helps to slough off vaginal tissue that would overgrow if you're just using estrogen. So you're using a DHEA cream and did you try different estrogen creams, different compounded estrogen creams? I mean, that's it's really vaginal bleeding or spotting during or withdrawal of therapy, excessive production of cervical mucus. You did 2. Were they brand names or compounded? Izzy says, I've been diagnosed with lichen sclerosis and I'm using a steroid cream. Absolutely. Clobetasol is the standard of care for lichen sclerosis. I also have vulvodynia and pudendal neuralgia. I have now developed nighttime need to urinate every hour. Is this because of the lichen sclerosis? I think it's more likely that the lichen sclerosis and the vulvodynia and the PNE are linked because you have tight muscles that are restricting blood supply. Lichen sclerosis is where your skin turns basically white and becomes very, very sensitive. So it may be that your muscles have gotten progressively tighter, that you first felt it with the vulvodynia, then you felt it with the lichen sclerosis, and now it's finally affecting your bladder. But of course, we also have to look at estrogen atrophy and your age and how that's going to contribute to vulvodynia. The pudendal neuralgia is the wild card here because pudendal neuralgia means you have a nerve that's being compromised by a tight muscle or a nerve that's being compromised in some way. And that's why we go right to muscles. Okay, so Joanne, I haven't forgotten about you. So again, chemicals, I could see you might have some chemical irritation, some chemical burns. Progesterone, if it's in the cream, is going to promote more bleeding because that's what it's supposed to do. I wonder about mechanical injury, or is it, if you're inserting it with a plunger, you know, the insert thing that comes with it, is your skin so dry that that's rubbing against your skin and basically cutting it? That's possible. What does your doctor think? I mean, the challenge here is that estrogen is so central. What about doing something like Vagifem, which is not a cream, it's a little tablet that you stick up in your vagina? That would be a second, a second option. It'd be very interesting to see if Vagifem caused any bleeding. You put it on your finger. Have you looked with a mirror? I mean, I would literally, what I do whenever I need to do that, and again, I have no shame, I'll share all my secrets. I have a low shelf in my bathroom, and so I put a mirror on top of the shelf, and I drop trowel, and I squat over the mirror so that I can look at myself, preferably in the daytime when there's a lot of light. I mean, I would do that because I would want to know where it's bleeding. I mean, like literally, I would squat, I would put it on, and I would just look at it for the next couple of minutes and see if you can figure out where the bleeding is coming from. Is it coming from the outside or is it coming from inside your urethra? I mean, and also, hon, how old are you? Can you give me your decade? You don't have to tell me exactly how old are you, but are you over 50, over 60, over 70? How old are you? Because the older you are, the more fragile your skin is going to be, by far. Fiona says, I've had IC for years. My biggest success has been from taking Utiva daily and seeing a wonderful pelvic floor physical therapist. Highly recommend. Flare-ups mostly gone. Yeah, baby. That's what we like. Excellent. Good job. Angel says, what's my favorite brand of spring water? Arrowhead or Calistoga water. But I have really good tap water here. So tap water is fine where we are also because Calistoga is just over the hill from where I am. And the water that we have, the natural water that we have here is really quite good. But if I'm traveling, it's Arrowhead or Crystal Geyser. Occasionally, I will do still Pellegrino, not sparkling, but still Pellegrino. That's been okay. Izzy says, "Thank you. I've been trying tolterodine, but I've had many side effects. Now you're given mirabegron. Should I use this? Mirabegron is much better than the tolterodine. Much. And the reason why, Hun, is because it's not an anticholinergic, so it's not going to come with those really big side effects of the anticholinergics, like the dry mouth, the dry eyes, irregular heart rate, weight gain, et cetera, et cetera. So the tolterodine, so the mirabegron, also known as Mirabetrix, is the go-to now. The challenge is it's more expensive, and a lot of insurance companies don't want to pay for it. They'd rather have you on the cheap stuff, even though it messes you up. Hi, Denise. Hi, Hada. Whoops. Can individual vitamins cause irritation like B12 or D? No. Well, B12 and D are fine. Vitamin C, ascorbic acid, if it's a cheap ascorbic acid that's derived from old citrus, discarded citrus peels, then that's going to be too acidic. If you're going for if you need vitamin C, we always recommend that you eat foods that are high in vitamin C, like broccoli and like bell pepper. Or you can do an ester C, which is not ascorbic acid, it's calcium ascorbate. And I had a bottle of it somewhere. We have it in the IC Network shop. It's called Ester C. Where is it? And B6, B as in boy 6, has been anecdotally linked to a little bit more bladder irritation, but B12 is fine. I take B12 every night. I take D every night. And then in terms of multivitamins, we do not do well with those Centrums, those one-a-days, because their vitamin C is the cheapest vitamin C. It's very, very citrus oriented. You want to do a true low acid multivitamin, and the best one on the market is Bladder Smart. Bladder Smart. And it's something I'm very, very proud of because I'm the person who triggered the development of low acid multivitamins. I was talking with the CEO of Far Laboratories years ago, and he goes, "Jill, if you could make anything for an IC patient, what would you make?" I know exactly what I'd make. I'd make a low acid vitamin. He said, "Why?" And I said, "Because I get this question every day. Is there a bladder friendly multivitamin on the market?" And there isn't. There isn't. And 6 weeks later, he called me back and he goes, "I have your low acid vitamin." It was called Multirite, made by Far Labs. So we sold that for several years. The challenge is it's a horse pill. It's really big and it's really hard to swallow. And so I asked Natural Approach Nutrition, the company that makes Bladder Builder and Allopath, I said, "Could you make me a low acid vitamin that is easy to swallow?" And he goes, "Sure." And that's Bladder Smart. And it is just a fabulous vitamin. I take it every night. We're sold out right now, but we should be getting it. We should be getting it in early December. I love the Bladder Smart multivitamin. I take it myself. I'm living proof. There's nothing, I have not been irritated with it at all. And I don't have anybody who's called me who said they've been irritated with it. And the cool thing is you can take up to 3 capsules. So 3 capsules is a full dose, but if that's too much, you can just do 1 capsule or 2. They are the future production. I do believe they're going to switch it to a small pill instead of a capsule, but it's not going to be a big horse pill. So again, over on the IC Network store, the IC Network has a shop where we have chair cushions and heating pads and all sorts of stuff. We got all the books, IC 101, the diet books, IC Shift Cookbook. And did I say chair cushions? We have all sorts of stuff like that. I never wanted to send, I never even fathomed that I would be selling supplements. But years and years ago, there were doctors who were telling patients their only treatment for IC was surgery, InterStim. And I had this patient call me, who was just sobbing. Nobody told me there were other things that I could have done before I had surgery. And she was harmed in that surgery. I don't remember exactly what, but she was pretty harmed. Those adverse events are common with InterStim, according to the FDA MOD database. So qualify that. Okay, so it just like dawned on me. Oh, patients needed a safe place where they could come see what their options were. And we had Pre-Leaf, we had Sister Protect back then, and kind of the rest is history. So we have most of the supplements over on the IC Network website now, and they're all lower price than anything on Amazon. Most of our prices on Amazon, well, a lot of the prices on Amazon are about $5 more than you would pay on the IC Network. Izzy says, do we ship to the United Kingdom? Izzy, I'm sorry. We don't. There's a workaround, though. Do you have anybody that you know in the United States that we can send it to? If we can send it to them, they can send it to you as a gift. But with Brexit, what happened is the laws changed, and we are now required to register with the government in the United Kingdom and collect VAT tax, and then send it to them every 2 weeks electronically. And our software literally can't do that. It just can't do that. We don't have an easy way to do that. And so I can't send it to the United Kingdom right now as a company, because I have to put an invoice on it. I have to declare the value. But if you have a friend or a relative that we can send it to you, even in Canada, you have to reimburse them for customs, but we can send it to them, and then they can forward it to you as a gift, and that's the only way. And lots of patients are doing it that way in the United Kingdom. And also we have all of our electronic books, PDF files and things like that. And you guys, for anybody who's low income, if you need something, especially our book IC 101, just email me and I'll send it to you. I can send you an e-copy for free. But we have bills that we have to pay. So we do, if you can afford it, we'd prefer that you buy it. But if you can't, I'm not going to turn people away. At least I try not to. Who is it? I had somebody say something to me, and I said, you do realize that like 95% of what we do, we give away for free, right? So that little sale actually means a lot to us. Izzy says, I don't know anybody in the US. Okay, Izzy, make a friend. You're in chat right now. So you're in chat on Instagram. Pick somebody on Instagram right now and see if you can create a friendship with them. Right? Those are, we ICers, we stick together. I have laws that I have to follow. So, Joanne, it's a small amount it's a small amount like a pink spot. And I have estradiol 0.01% by Mylan. So, I get my hormone cream from the Women's International Pharmacy. They don't pay me. They don't pay me at all. It was my own gynecologist who said, Jill, we already know you're super sensitive. We're not going to waste time giving you any brand names. We're going straight to the pharmacy that does the formulas for the people who have the most sensitive skin. And so he introduced me to the Women's International Pharmacy. I've used them ever since, and they've been wonderful, absolutely wonderful. Every woman in my family gets their estrogen cream, and it's cheap. It's also very cheap. It's like $50 for a 3-month supply, whereas Premarin could be $150. Bunty here, it says ship to. I used it a few times. Maybe it works in the United Kingdom. There are some services that are kind of independent shipping services but they're questionable sometimes. But you can go to a third-party shipper and they will order it for you and then they will ship it to you. And Bunty says it works in Germany. Hey, Bunty, somebody just told me that the German ICA folded. Do you know anything about that? That the German ICA is no longer. I was shocked. That was Jürgen and Barbara Henson, who's been doing that for decades. Jenna says, do I recommend probiotics? I was taking Love Bug, but they use cranberry in their ingredients. The thing about probiotics is that if you take the same probiotic for years and years and years, you are artificially distorting the population of good bacteria. And I don't think that that's a smart thing to do, because there are lots and lots of different species of bacteria that live in our bodies that perform really important functions in the human body. They help us digest food. They provide nutrition for the cells lining our bowel, et cetera, et cetera. So I think it's important to mix it up. I mean, so to use one brand for a couple of months and switch to another brand for a couple of months, switch to another. But live cultures really are the best. I do coconut milk yogurt specifically for their probiotics several times a week. I don't do milk-based yogurts. They irritate, they cause a little bit of bowel issues for me, but coconut milk yogurt is the bomb and it works really well. And so that's where I get my live cultures for me personally. When I do it, Culturelle is a brand that has been very popular. There's so many different brands of probiotics out there. Generally, if it's refrigerated, that means that it's live and it's really, really probably better than something that's not refrigerated. We have on the IC Network website Biome Defense probiotics. And I think, and so that's a very, natural approach to nutrition. This company is just knocking my socks off with their projects. It's amazing what they've continued to do, are doing and continuing to do. And so we have Biome Defense probiotics there. We were down to, I don't know, the last 20 or 25 bottles. And then they have a new one that's coming out specifically for, hold on. Here it is. It's called L Flora. It's a pre and probiotic. And that's what we'll be switching to. So we're going to discontinue the Biome Defense probiotics and we're going to the L Flora. And it's really designed for bacterial vaginosis, candida overgrowth, vaginal digestive health. It just, they're always working on trying to make their things better. So I think that that's supposed to be out either in December or early next year. So I would just mix it up and look for natural sources of probiotics. Bunty says, can I explain it? I did not understand it. Do you mean that Germany does not work with the guidelines from the US? No, Germany uses the ESSIC guidelines, the European Society for the Study of IC Bladder Pain Syndrome. And it's really quite, I got to say, it's really quite bleak. I mean, we're now having these international meetings of patient organizations, and I'm shocked at the lack of resources in Europe for patients, the lack of coverage, the cost of goods, everything that's available. I mean, there's so few things available in Europe that are available here in the United States. And then the European Union doesn't like supplements. And so they often push back on supplements that are set from the United States. Kim said, what helped me with vulvodynia? Okay, so okay. I broke my tailbone when I was in 7th grade. My bladder symptoms started 2 months after I broke my tailbone. Okay, so it was never a bladder issue. It was always pelvic floor for me back then. And I had a urethral stricture. My urethra is very narrow because my pelvic floor muscles were very tight. So the next thing that happened was I developed vulvodynia, like in 9th grade, all the way through high school. It felt like I had a yeast infection all the time. Only the doctor would look at me and he would say, you're fine. You're not even red. And I'm like, then why do I feel like I have a yeast infection? Why is it burning? Why am I having trouble wearing pants? Sandy, it's in Arizona. What and it was bad, hon. I could not wear jeans. I didn't wear underwear. I cut lines down my underwear so nothing was touching me. You name it, I did everything I could. And I found a vulvodynia support group here in town. And so I was like 18 or 19 when I went. And these older women, they were so sweet. They took me under their wing. And they helped me a lot. And one of the things that really helped me was, where is it? Where is it? A pair. Oh, here it is. Okay. So for symptom management, so again, we want to differentiate between cause and symptom management. Okay. So for symptom management, one of the things that they said is your skin is very sensitive. And I'm like, I know, it's terrible. And they go, well, the problem is that urine, when you pee, urine crosses your vulva as you're peeing it out. And that urine is irritating your very, very sensitive skin. And the thing is when you use toilet paper does not get the chemical residue from urine off of your skin. Water does. And so the first thing that helped me tremendously was a simple $3 Perry bottle. You fill it with water, you squeeze it, water comes out of the top. They're in the IC Network store for $3 and a quarter. I don't remember how much they are. They're under $5. And what they told me to do is every time you urinate, and anytime you use the bathroom anyway, use room temperature water and rinse yourself off. And it took about 3 to 4 weeks of doing that before the volume turned down of my vulvodynia pain. I did not really, realize that my skin was being very, very badly irritated. So the question now, anyway, Perry bottle, really, really helpful. And I would really encourage you to give it a try. Okay, but now let's talk about cause for a moment. So why does vulvodynia occur? Well, vulvodynia, dynia means pain, vulva means vulva. It means you got pain of the vulva. Doesn't say anything about why. In my case, it was all about tight pelvic floor muscles. Very, very tight pelvic floor muscles that were restricting blood flow to my vulva. Thus, my vulva was being deprived of oxygen. It was being deprived of nutrition, and it was not healthy. And that's why chemicals from urine was so irritating. So we now have a very, very, very direct correlation between vulvodynia and tight pelvic floor muscles. Now, what made my vulvodynia so interesting is that I had a hot spot. So this is underneath the skin. This is your pelvic floor muscles, right? So these are, and it's broken. Yes, it's broken. I know. So your skeletal muscles have, for a woman, 3 holes. We got a hole for the urethra, a hole for the vagina, and a hole for the rectum. You know where my vulvodynia hurt the most? Right here on my perineum. Man, it was like glass. This is where this section was where my vulvodynia was the worst by far. By far. I was in agony right here. And I never really understood why until Dr. Weiss explained it in this book. That although this is not anatomically correct, underneath the skin, directly underneath the skin of the perineum, is something called the perineal body. It's an attachment point for 4 muscles. So that burning of my perineum was being caused by these muscles spasming or getting very, very tight. And I can show you a picture of it. Okay. Now, this book is very anatomically correct. I'm going to cover up the penis, but they have the same thing. And so when we go here, I'm showing it to Instagram first, and I'll show it to YouTube. So here's your vagina. There's your clitoris and your urethra. I'm sorry, there's your rectum. Okay. You see this little round thing right there? That is the perineal body. So that perineal pain is being driven directly by tight muscles pulling on the perineal body. And let me show YouTube. You see this little round nub right there? That is the perineal body. So, yes, you feel like you have the world's worst yeast infection, and it's burning, and it's affecting the skin. It's affecting the skin, but it's actually being caused by muscles immediately underneath the skin. Now, let me just go to one other thing here that I think I can read to you. Hold on a second. Okay. This is such a good book. This is filled with case studies after case study. I wanted to see, though, if I could. This is a huge section on clitoral pain, orgasmic pain, bowel pain. I wanted to see if I could get to the scrotal pain, tailbone pain. Okay, here we go. Okay, so let me just read you this story. Okay, this is Rachel's story. Rachel, now again, any age. The name of this book is Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. This is the book that will change your life. Of any of the books that we have, this is by far the most insightful, descriptive, educational book, and I love it. And it's filled with success stories. Let's see here. Rachel's story. Rachel was 77-year-old. Okay, but remember, I was like 15. So Rachel was 77 years old at the time of her first appointment. 16 years prior, at the age of 61, she began experiencing a burning sensation in the vulva. This led to a diagnosis of vulvodynia and the subsequent surgical removal of the tender tissue around her vaginal opening. When her pain persisted, a laser procedure was performed to destroy any residual painful tissue, and yet the pain remained. She saw another physician who told her that the vulvodynia was cured and that it was all in her head. And here I should interject a reminder, vulvodynia is an umbrella term that simply means vulvar pain. This is not a specific diagnosis. How can we possibly cure a disease without definitively identifying and treating the root cause? All too often, physicians attack vulvar pain with surgical removal of painful tissue, neither suspecting or addressing the underlying muscle and nerve cause. So 5 years after her initial surgery, and having finally begun to notice a reduction in her vulvar pain, Rachel had a bladder suspension operation for urinary stress incontinence, and unfortunately, the surgery set off a vulvar pain flare. A follow-up evaluation revealed an infection caused by the surgery, which was treated with antibiotics. All right, so hold on. Rachel consulted me approximately 1 year after the bladder suspension procedure. Her complaints included a dull vulvar ache that increased with sitting and walking, urinary frequency, and tailbone pain when sitting. My examination revealed tender trigger points in the urinary sphincter, obturator internus, puborectalis, iliococcygeus, and coccygeus muscles. I treated these muscles with internal and external myofascial release, and her vulvar pain cleared completely. For the first time, she could take long automobile trips and expand her social life. Yet Rachel still had one lingering complaint. Her tailbone hurt. I performed additional internal release to mobilize the coccyx and eliminate some of these trigger points. And then, because of the severe abuse these muscles had taken over the years, it was necessary to add trigger point injections to alleviate tension and pain. At the time of her most recent visit, Rachel reported that she was symptom-free and able to go shopping, which was her favorite hobby. You may be wondering why Rachel's tailbone had become such an issue when the initial problem was vulvodynia. In her case, years of vulvar pain had conditioned her to get off of her bottom and sit on her tailbone. As I explained earlier in this chapter, this protective mechanism commonly causes stubborn trigger points to develop in the iliococcygeus and coccygeus muscles. Thus, even though the vulvar pain and much of the muscle dysfunction had subsided, trigger points in these two muscles required further treatment. My parting comment on Rachel's story and Lorraine's has to do with central sensitization. Despite the longevity of their symptoms, both women's nervous systems somehow managed to maintain stability, thus sparing them from a prolonged recovery. How can that be? My editor asked. I have no idea, was my reply. No one can explain why many or most patients respond in a particular way, while a minority do not. Coincidentally, both Rachel and Lorraine finally got lucky. As patients' histories featured in this chapter illustrate, the straightforward case is a rarity. Patients with chronic pelvic floor and perineal problems generally present with a multiplicity of interrelated symptoms, as opposed to one isolated complaint. Perineal pain can include urinary symptoms and genital pain and orgasmic discomfort, rectal pain. Let's see, hold on. And pain associated with the tailbone. Hold on. Perineal pain can include urinary symptoms and genital pain and orgasmic discomfort. Anal pain can be associated with pain in the tailbone, and tailbone pain can adversely affect all of the pelvic floor. Vulvar pain and urinary symptoms are also frequently included in the mix. This phenomenon relates to the close connections and continuity among the pelvic muscle groups that allow for the transfer of tension and trigger point pain. It also relates to the close connections many of the pelvic muscles share with the pudendal nerve, which provides sensation and function to most of the structures. The potential crosstalk between muscles and muscles and between muscles and nerves underscores the need. Well, anyway. Hi, Inda. Thank you, Filski. This book finally connected all of the dots in my case. Sandy, you want to know the page? It's towards the end. Page 385. 385 is Rachel's story, but that whole chapter is important because of whether it's scrotal pain, orgasmic pain, vulvar pain, anal pain, it's coming right back down to muscles and nerves. Muscles and nerves. Breaking through chronic pelvic pain. And it's over on the IC Network, right on the front page of our store. This is a book I recommend for everybody. I mean, I've read this a couple of times, and every time I read it, I learn something new. And you can see, man, I study it. I highlight. I do everything because I want to learn this stuff. Like one of the things he says in this book is as long as you have a trigger point, you'll never have healthy muscles, right? So these are muscle fibers. These are injured muscle fibers that have trigger points. And if you look closely, look at what the trigger point does. It restricts blood supply. So you got healthy blood on this side, and now we got weak blood on this side. That's a problem. That's a problem. It's all about blood supply. All right, guys. Well, speaking about blood supply, my left butt cheek is starting to vibrate, which means that I have been sitting for long enough and I need to get my tush up and moving. So I think we're going to call it here. And when I see you again next Sunday, wish me luck on my oral surgery on Wednesday. And don't be surprised, you will see a missing tooth. I can't do anything about it. It was broken by a hygienist cleaning my teeth. So last week. So, and that hurt just touching it. Yeah. So wish me luck. I feel good about it. Happy Thanksgiving for those of us in the United States. And we will see you next week. And if you find these meetings helpful, please think about becoming a member of the IC Network so you can get our wonderful magazine, the IC Optimist. Anybody who would like samples of pre-leaf, if you email me your mailing address, my email is icnetwork@mac.com. icnetwork@mac.com. If you email me your snail mail address, I'll send you out some samples of pre-leaf so that you can give it a try. Oh, thank you, you guys. I love to see those hearts. That's wonderful. And just be well, be strong, be strong. Don't listen. I need you. This is what I need you to do. And I'm looking at you right now. You did nothing wrong. This is not your fault. No shame, no blame. Stop with the negative self-talk. You are not damaged goods. You are perfectly lovable. You're hurt. And just like somebody who was hit by a car, they need care. You need care. Don't hide it. You've got to teach your children that when somebody is hurt, that everybody steps up and helps, right? And now we got the holidays coming up and Thanksgiving coming up, and this is where things get a bit more stressful for us. And so don't hide it from your family. Don't hide it from your family. Teach your kids to help. No shame, no blame. You are destined for great things. You are destined. As long as one person needs you, you are meant to be here. You are meant to be here. And if you can look in the mirror at the end of the day, and if you've helped just one person that day, that is a good day. That is a day well lived. So get rid of the big goals and focus on little goals right now. 15 minutes a day, do your pelvic floor work for 15 minutes a day. Make a meal that you know is going to be IC friendly for 15 minutes a day. Practice a little bit of mind body medicine. We got to calm that central nervous system down. Mind bodies and medicine really works well for that, especially if you have chronic overlapping pain conditions and sensitive nerves like I do. And most of all, for 15 minutes a day, actually for an hour a day, I need you to laugh, because laughter modulates pain. So feel free to watch funny videos. It's okay. Feel free to get on TikTok as long as they're funny TikToks, right? Feel free to read a book. You are entitled to self-care. You are entitled to self-care. So anyway, my newsletter is going to go out this week. It's going to go to about 35,000 patients. If you want to get the IC Network newsletter, come on over to the IC Network. You'll get a pop-up window. Stick your email address in there. I am very respectful. I only send out newsletters every 2 or 3 months. There's no spam, nothing at all like that. I very carefully curate everything. I really try to be respectful, because we're all getting sick of junk mail. I don't send out junk mail. And you will also be able to get our 40-page flare management guide as a gift. And it gives you hour-by-hour rescue plans. And I will be rewriting that early next year and giving you a lot more stuff, because we have different types of flares. So I have a lot of good, fun plans for 2023, early 2023. So working together, we're going to get through this. All right, my friends, I wish you well. Sleep well tonight. Have a great Thanksgiving for those of you in the United States. For everybody else, start decorating. Get your Christmas lights up. Lights make us happy. All right, I'll see you later. Okay, we're going to let Instagram go. Instagram is gone. Woo, we had 65 people on Instagram. Yes. And for those of you on YouTube, all right, you guys, be well. I will see you again soon. I promise.